Okay, so good afternoon to everyone. How are you, champions? How are you? Good afternoon. Pharma profession, good afternoon, good afternoon. Okay. Welcome back to GDC English classes. Welcome back. So here we have another session, Hana, for you guys. And this one will be solving that NIPER JEE model paper number 1 that you have solved yesterday, right? Yesterday. And now we will be explaining all these things for you guys, right? NIPER JEE 2026 model paper number 1. All right. Good afternoon, farmer profession. All right. So how many of you are here? Just send me hi. Just send me hi. Just send me hi if you are here. Yeah, 7 people right now. All right. All right. Let's go. Just give me a hi. Then we will be starting this one, huh? Yes. Okay, fine. Chalo. I hope your preparation is going very well for the NIPER JEE 2026. I think 20 days left, 20 more days left for your NIPER JEE 2026 examination. And I wish you all the very best for your preparation. And yes, the model paper is live. 20 days, 20 model paper you will be having on your batch, right? So every day you'll be getting one model paper and you have to solve it. And the next day itself at 10 a.m., sorry for the today, but next day itself for 10 a.m., you'll be having live solution of that examination that you took, a day before, right? So are we good to go? Are we good to go? Just give me a thumbs up so that we can start. Yeah, just give me a thumbs up so that we can start, guys. Yeah. Anyone? No one. Chalo, all right, guys. Let's go ahead then. Okay, so let's start with the pharma section that we have today. All right, pharma section. Okay, let's start with the pharma section in which we'll be doing pharmacology, pharmaceutical jurisprudence, pharmacognosy, biochemistry, physics, and allied subject as well as microbiology. Okay, so let's start this one. All right, let's go ahead now. The first question of the pharmacology that we have today. Okay, Sampriti. All right, pharmacology. All right. So here's the first question. Which of the following are not actions of muscarinic receptor? First question that we have. Which of the following are not the actions of muscarinic receptors? I'm asking. What's that? What's that? Tell me. Is it your meiosis? Is it your bronchodilation, vasodilation, or increased secretions? Not they have asked, right? Just think about this one. Not they have asked, right? Not actions of muscarinic receptors. Not muscarinic receptor means cholinergic receptors. But there is a no cholinergic receptor. Which one is it? Is it your meiosis? Is it your bronchodilation? Is it your vasodilation or increased secretions? Yeah. Meiosis, yeah, cholinergic system. When we going to sleep, obviously meiosis will be taking place, right? Acetylcholine acting onto the M3 receptor. Acetylcholine acting onto the M3 receptor can shrink your eyeball. That's why meiosis will be taking place. Bronchodilation, no, onto the same M3 receptor, but M3 receptor constriction of the bronchial muscles will be taking place. So bronchodilation, not bronchoconstriction will be taking place for that, right? So bronchodilation would be your correct answer. Vasodilation, yes, again, vasodilation also takes place. Increased secretions, obviously, as I told you, SLUD, right? SLUD is going to be increased in cholinergic things that we have. S for salivation, L for lacrimation, U for urination, and D for defecation. Akash, we have asked not over here. Okay. So understand what I have asked over here. So B, bronchodilation is going to be your correct answer. Right? So let's go ahead now. Nicotinic antagonist is what? Pilocarpine, succinylcholine, hyoscine, or atropine. Chalo, tell me this one. Nicotinic antagonist. Is it your pilocarpine, succinylcholine, hyoscine, or atropine? Which one is it, guys? Come on, tell me. Tell me this one. That's your exactly pharma profession says that's your succinylcholine. And just like the tuberculin, we have succinylcholine as well, which is going to be inhibit the NM receptor, right? NM receptor antagonist, that is nothing but your succinylcholine. Simple? Very good. Very good. Now let's talk about this one. Sulfasalazine metabolized by sulfasalazine. Sulfasalazine is your mutual drug, if you remember, right? It is your mutual drug and it releases two drugs. That is your sulfapyridine, sulfa, sulfapyridine, as well as 5-ASA, right? 5-ASA. So this is metabolized by which one? Esterase, keto, or azoreductase, or oxoreductase? Tell me one. Yeah, yes, exactly. Pharma profession says right. Azoreductase is going to be your correct answer of sulfasalazine, right? Azoreductase is the mechanism through which the sulfasalazine gets metabolized, right? As azoreductase over here. All right, so let's go ahead now. Peripheral and central emesis is caused by. Peripheral and central emesis is caused by. Is it through apomorphine, copper sulfate, digitalis, or ergot? Chalo, come on. Peripheral and central emesis. Emesis is nothing but vomiting, right? Vomiting. Is caused by apomorphine, CuSO4, digitalis, or ergot. Exactly. Very nice pharma profession, right? Apomorphine. Apomorphine is going to elevate the dopamine levels. And you remember, once the dopamine levels gets increased, so that is also remember, that is also responsible for vomiting purpose as well. All right. That's why apomorphine is going to be have your responsible for peripheral as well as central MSS, right? Because apomorphine is going to increase the dopamine level and increased dopamine level will be induce the vomiting as well, right? Digitalis is your cardiac glycoside. Ergot, ergotamine and ergometrine. Ergotamine is useful in your prophylaxis of migraine as well as ergometrine is your uterine contraction, right? CuSO4, copper sulfate. Copper sulfate is known to be as your blue vitriol, if you remember. This is your blue vitriol. Okay, remember this one. All right, let's go ahead now. Which of from the following are cholesterol reducing agents? All right, simple question. Which from following are cholesterol reducing agents? Statins, dipins, triptans, or sartans? Chalo, tell me this one. Yeah, come on, guys. Do say into the comment section. Do say your answer. Write it down. Hana, do some interaction with us. Yep. Hana, don't be afraid of saying anything. Chalo, let's go. Yes, exactly. 5 ka A. Obviously, statins is going to be your correct answer. Hana, HMG coenzyme A reductase inhibitor. HMG coenzyme A reductase inhibitor, that is your statins, right? Statins is very much useful to reduce down the cholesterol. Depends are your dihydro depends, right? Dihydro DHPs, dihydropyridines, nifedipines, right? Nifedipines, felodipine, nicardipine, triptans. These are your sumatriptan, useful in migraine, right? Migraine. Dipins useful in hypertension. Sartans, low sartan, tell me sartan also used in hypertension, right? Very good, Mahi. Very nice, statins. There is one adverse effect of statins also. Do you remember, guys? Do you remember? What is the adverse effect of statins? That is your rhabdomyolysis. Rhabdomyolysis. right? This is important, guys. Rhabdomyolysis. Statins do have the adverse drug reaction of rhabdomyolysis. So this is important. They have asked before. Just write it down in your notes over here as well. All right. Rhabdomyolysis. Very nice. Now, which of the following causes cardiac arrhythmias? Okay, which of the following drug can cause cardiac arrhythmia? Is it your amlodipine, terfenadine, phenytoin, or amphotericin B? Chalo, this one. Come on, guys. Yep. Let's go, let's go, let's go. Come on, fast, fast. Yeah. Very good, pharma profession. Very nice. What's your name, by the way, pharma profession? What's your real name? Anna? Amlodipine? No, amlodipine, you can say it's a dihydropyridine, doesn't cause cardiac arrhythmias. Terfenadine, that is your what? H1 antihistaminic. H1 antihistaminic, right? Antihistaminic, right? And you remember that H1 antihistaminic, out of which T, if you remember, T, terfenadine, E for Avastin, as well as A for astamizole. Astamizole. These are three drugs in antihistaminics which can cause cardiac arrhythmia. That is nothing but your QT prolongation. QT prolongation and your what? And your Torsades the point, right? Torsades the point. Remember, this is the thing over here. Terfenadine, not only terfenadine, Avastin as well as astamizole. These three drugs can cause QT prolongation as well as Torsades the point. Very nice. All right. Now this one. In which of the phase microdosing is directly given to patient without preclinical testing? Yeah. In which phase microdosing is directly given to a patient without preclinical testing? Is it your zero phase, first phase, second phase, or third phase? Yeah. Come on. Yeah. Simple question. Very simple question, right? Very simple question. Come on. Come on, guys. Do interact. 16 people are here, but still only one people is replying over here. Huh? Chalo, come on, Mahi, very nice. Pharma profession, very good. Very good. Mahalakshmi, yes, very good. Keep coming, guys, keep coming. Show up, show up, and let your motivation come into your comment section. Then only we can understand, na, ki, yeah, we are helping some of you guys, right? How can I know that? Right? So that's why you have to come up, show up yourself into the comment section. Do let everyone know that you are not small enough. You are good enough. Right? Gorli Navyashri. Very nice. Very nice. Yes. So here is your phase zero. Phase zero is also known to be as your micro dosing phase, right? In which 100th dose is used to be given at zero phase, to the just to assess the safety, right? To assess the safety. Very good. Phase zero is going to be your correct answer. Very nice. Now this one. Drug used in the case of cerebral malaria. Cerebral malaria, guys, is it your primaquine, chloroquine, quinine, or quinidine? Chalo, come on, fast. Simple question. Simple question. Primaquine, chloroquine, quinine, or quinidine? Yep. Come on, come on. Drug use in the case of cerebral malaria. Cerebral malaria may we don't even give primaquine, we don't even give chloroquine. We used to give the quinine only, right? That's your Cinchona alkaloid, if you remember, right? Cinchona alkaloid that has been useful as in cerebral malaria, right? Quinidine is useful in your cardiac arrhythmia. Cardiac arrhythmia mein it has been useful, right? So this is you have to remember. All right, quinine is going to be your correct answer. Now this one. Which of the following scientists has isolated the hormone insulin for the first time? Okay. Simple most question. Simple most question. Is it your Watson and Crick, Benting and Best, Boyer and Cohen, or none of the above? Yeah, come on. This is your Benting and Best, obviously, right? Benting and Best discovered the insulin for the first time, and insulin was discovered as the 51 amino acid, in which 21, right? 21 amino acid was there in A chain, and 30 amino acid was there in B chain, and they interconnected with which bond? That is your disulfide bond, right? That is your disulfide bond. Very nice. Okay. Now this one, United for Dignity campaign honors the dignity of people who have experienced which disease? Yeah. United for Dignity campaign honors the dignity of people who have experienced which disease? Is it your COVID, leprosy, cancer, or tuberculosis? Anyone? Anyone? Yeah, United for Dignity. That's a human cause, right? Exactly, farmer profession. Very good, very good, very good. That's your leprosy. Very good. And leprosy is also known as Hansen's disease. Yeah. If you remember, leprosy is also known as Hansen's disease, as well as uh, dapsone is one of a drug which has been useful over here. Okay. Farmer profession. Okay, Shraddha is here. All right, Shraddha. How are you, Shraddha? Mahi, very good. B, yes, leprosy is going to be the correct answer. Now this one. Okay, Ashwarya. All right, all right, all right. So now this one. Which of the following is prodrug? Which of the following is prodrug? Is it your sulfasalazine, captopril, aspirin, or siloxane? Prodrug, I'm asking. Prodrug, I'm asking. Prodrug. Right? Hansen, very good, Shraddha. Anna, so sulfasalazine, you know that sulfasalazine, previously also I told you, right? बढ़िया सर्वस नॉन फार्मा अरे तुम लोग ना नॉन फार्मा sulfasalazine that is converted into sulfapyridine, right, plus 5 ASA, right? Sulfapyridine plus 5 ASA, and here we have as sulfapyridine used in rheumatoid arthritis, whereas 5 ASA is converted and has been useful in your ulcerative colitis. It has been useful in your ulcerative colitis, right? So this is important to understand. Captopril is not a prodrug. Remember, captopril is not a prodrug. Lisinopril, even lisinopril is not a prodrug. Okay. Out of ACE inhibitors, all are prodrug except captopril as well as lisinopril. Right. So that is important to understand over here. All right. Chala, let's go ahead now. What is the correct sequence in cell cycle? Oh, simple. What is the correct sequence of cell cycle? Is it your G1, G2, SM, G1S, G2M, G1, G2, MS, or G1S, M, or G2? Yeah, captive and listener. Yes, exactly. This one. Yeah, exactly. Very nice. So G1 phase, then DNA synthesis, then G2 phase, and after then mitotic phase. Then mitotic phase. Very good. Very good. Vijay, pharma profession, Somnath, Mahalakshmi. Very nice. Very nice. G1, S, G2, and then M. All right. Also, you have to remember those drugs which are going to act onto the different sites, different cell phase. G1 phase. What are those drugs which are going to act onto the G1 phase, guys? Can you tell me? Can you tell me what are those drugs? What are those drugs which are going to be acting on G1 phase? Anyone? Anyone? S phase, that is your anti-metabolites. Anti-metabolites, right? Folate reductase, है ना? Purine, antagonist, pyrimidine antagonist, right? M phase mein we do have vincristine, vinca alkaloids as well as taxanes. Vinca as well as taxanes are going to act onto the M phase, right? G1 lamba. बहुत बढ़िया. That is your melatonin. Okay, melatonin is secreted by which glands? Melatonin is secreted by which gland? Is it your pituitary gland? Plant compounds M phase. Yes. है ना? Pituitary gland. Is it through hypothalamus? Is it through pineal or thyroid? Yeah, come on. Tell me this one. Yeah. Melatonin is secreted by which gland? Is it through pituitary, hypothalamus, pineal, or thyroid? Yeah, that is your C. Pineal itself, right? Pineal gland se melatonin has been released, and melatonin is responsible to maintain what? Maintain circadian rhythm, right? It is used to maintain circadian rhythm. Pituitary, we do have different lobes of pituitary. Anterior pituitary, middle lobe of pituitary, posterior pituitary, right? From anterior pituitary, we do have what? For anterior pituitary, we do have G2 pad, right? G2 pad. G first growth hormone, right? And then gonadotropin, just like LH as well as FSH, right? Sorry, that is your FSH. FSH. P for prolactin, right? P for prolactin. E for adrenocorticotropic hormone, and T for TSH. Okay, thyroid stimulating hormone. Yay. G2 fat from anterior pituitary, from middle lobe of pituitary. That is what middle for M for middle, M for melanocyte stimulating hormone MSH, and from posterior pituitary we do have what? Vasopressin. Vasopressin, that is also known to be as your antidiuretic hormone, as well as oxytocin, that is being released from the posterior pituitary. That you have to remember, guys. Pituitary hormones is very much important. Hypothalamus, all the releasing hormones, right? Thyroid releasing hormone, right? Somatostatin, right? So these are released from dopamine itself. Ana? Hypothalamus releases the releasing hormone, thyroid releasing hormone, growth hormone releasing hormone, right? Dopamine, somatostatin, pineal se melatonin, and thyroid se obviously T3 and T4. But from parafollicular cells, we do have calcitonin. If you remember, parafollicular cells say calcitonin, and follicular cells say we do have T3 and T4. All right. So this is, you have to remember all these things. All right. Let's go ahead. Let's go ahead now. Now this one. Metformin belongs to which of the chemical class of anti-diabetic drug? Metformin belongs to which of the following class of anti-diabetic drug? Is it going to be your biguanide, thiazolidinediones, sulfonylureas, or alpha-glucosidase inhibitor? Yep. Which one is it? Metformin. Metformin, guys. Simple, 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 simple. Bacha knows. Right? Bacha knows. Yeah, exactly. Shraddha says A, Mahalakshmi says A, Somnath says A. Very good. Very good. Right? Hana, AMPK activators. Yes, exactly. Biguanides, metformin, as well as if you talk about fenformin. Right? These are the two drugs which are considered to be as your biguanides. Also, you can see, like AMPK activator. AMPK activator. Right? Metformin and fenformin are being used in your obese patient, just because they do weight loss. They do weight loss, right? And if I talk about adverse drug reaction, fenformin is banned. Fenformin is banned just because of the lactic acidosis. Lactic acidosis, whereas metformin is very much marketed right now these days, but M for metformin and M for megaloblastic anemia. Megaloblastic anemia. Okay, just because vitamin B12 deficiency can be taking place. Vitamin B12 deficiency can be taking place. Although metformin, that is your biguanides. Also, if I talk about thiazolidinediones, these are very much useful to increase the insulin sensitivity. Okay. Whereas if I talk about sulfonylureas, they are going to increase the insulin secretion. secretion. Okay, insulin secretion. Alpha glucosidase inhibitor 2026 GPAD. They have asked one question from alpha glucosidase inhibitor, that is nothing but your acarbose, right? Acarbose as well as voglibose, right? Very good, Shraddha. Very nice. Very nice. Very nice. Yeah, rose pio thoda thoda. Exactly. Thiazolidinediones, rosiglitazone as well as pioglitazone. Alright? Very nice. Chalo. 4G, exactly. Now this one. Congenital diseases are what? Congenital diseases, diseases present at birth. Deficiency disease occurs during life, spread from one individual to another. What's that? Genital diseases. Congenital diseases are what? Disease present at birth, deficiency diseases, occurs during life, or spread from one individual to another. What's that? Anna, that is, this one is your communicable diseases, for example. This is your communicable diseases. Okay? Spread from one individual to another, that's a communicable disease. Alright? But disease present at birth, that is known to be as a congenital. One of the thing I got to remember that communicable diseases ka head office is present in your Delhi, right? Delhi. This is you have to remember. Okay, communicable diseases ka head office that is in your Delhi, whereas congenital that is A for sure. Very good. है ना? Mahalakshmi, Shraddha, Somnath, profession, uh, Kavi, Nilas. Okay, yes, exactly. A is going to be your correct answer. Now this one. Beta 2 selective agonist is what? Salbutamol, propanolol, atenolol, or timolol. Yeah, this is beta 2 selective agonist. Beta 2 selective agonist that we have SABA as well as LABA. है ना? So SA, that is your short acting beta 2 agonist. Short acting beta 2 agonist. L for long acting beta 2 agonist. Right? Whereas if I talk about salbutamol, to salbutamol, yes, salbutamol is considered to be as your SABA, not LABA, short acting. Salbutamol as well as terbutaline. Salbutamol as well as terbutaline, these are considered to be as your SABA. Right? Whereas if I talk about LABA, then LABA, then this is your salmeterol as well as formoterol, right? These are your LABA, long acting beta 2 agonist, right? Simple. Okay, very nice. Which of the following is your immunosuppressant agents? Okay, immunosuppressant agent. Is it your cyclosporin, tacrolimus, muromonab, CD3, or all of the above? Chalo, tell me this one. Yeah, exactly. Shraddha. है ना? Which of the following is immunosuppressant agent? Is it your cyclosporin, tacrolimus, muromonab, CD3, or all of the above? Yeah, come on, guys, come on. Say the answer in the comment section. है ना? Okay, that's nice. That's your all of the above. All of the above. Very good. Cyclosporin as well as tacrolimus. These are your calcineurin inhibitors. Calcineurin inhibitors, right? And miromonab CD3. Miromonab CD3. That is for CD3 antibody, right? So all of the above is going to be your correct answer. Anti-CD3 body, that's your miromonab CD3. All right. This is you have to remember, guys. This immunosuppressant, these are your biological drugs to be precise, right? Biological drugs. Very much important. How you can remember this? How you can remember this? Sarkari option, yes. Acha, do let me know. Do you want trick to remember all these one, or is it all okay to you right now? You want trick to remember this one, or else? Tell me. Then only I will explain, otherwise I will not. Tell me. Raise your hand if you want the trick to remember. Because this one is a very much important immunosuppressant drugs. Yeah. See, calcineurin inhibitor. These are your cyclosporin as well as tacrolimus. Okay. Calcineurin, that is your cyclosporin as well as tacrolimus. है ना? No, no, हाँ, श्रद्धा, तुम तो वैसी टॉपर हो, right? So that's your CT cancel. Remember CT cancel. C for cyclosporin and T for tacrolimus. That's your cancel means calcineurin, right? mTOR inhibitor, है ना? This is your set max. If you remember a channel used to come onto the TV, set max. So set max is your S for sirolimus, E for everolimus, and T for temsorolimus. Don't don't be confused temsorolimus as tacrolimus. Okay, so this is, you have to remember, set max. M for mTOR inhibitor. Okay, anti-proliferative. These are all your, to be precise, you can say like alkylating agents, right? Glucocorticoid, that's your prednisolone. Biological agents are becomes very much important. How you can say like this one, TNF alpha, TNF alpha. So T A N T N T N. Say N A to A N, right? Infliximab INF. If you just remove this one, so what will become? TNF, right? Infliximab, TNF. See, adalimumab you have to remember. IL-1, one receptor antagonist. So one, which alphabet comes at first position? That's your anakinra. Anakinra. So one, right? IL-2 receptor antagonist. That's your basiliximab as well as daclizumab. Basiliximab as well as daclizumab. You have to remember. So B comes at second position, and Hindi we used to say D for do, D for daclizumab to 2. Anti-CD3, that is written over here as well. Muromonab, CD3. Polyclonal antibody, that's your anti-thymocyte antibody as well as ROD immune globulin. I hope it's very much clear to you. All right, let's go ahead now. So this is your 20 days, 20 model paper, guys, for your NIPER examination. And as I said, will be a continuously, you'll be having 20 days examination, continuous on a basis. And after that, on 10 a.m., you'll be having your live explanation as well. All right. So this is the thing. Pharma question will be having 120. Then GK will be having 25, English will 15, reasoning 25, and aptitude 15 questions will be there only. All right. So be ready for that one. All right. Now let's go ahead. Which is a novel histone deacetylase inhibitor used for cancer treatment? Histone deacetylase, guys. Inhibitor used for cancer treatment. Is it your romidepsin, rituximab, rotigaptan, or ritanserin? Yeah, that is your romidepsin. Exactly. Very good. Very good, Shraddha, as well as pharma profession. Very good. So, dissociative anesthesia. Simple. Dissociative anesthesia is seen with which one? Halothane, ketamine, chloroform, or nitric oxide. Yeah. Chalo, come on, pass. Come on. Dissociative anesthesia, that is nothing but your ketamine only. And this is your NMDA antagonist, right? NMDA antagonist, right? Good afternoon, Khurana Pandit. All right. That is your NMDA antagonist, ketamine. All right. Out of that, there are also some others, NMDA antagonists. You have to remember dextromethorphan, ketamine, right? There is one another, amantadine, right? NMDA antagonist. These are right. Chalo. Now this one. Which of the following is your dopamine agonist? I'm asking. Okay. Which of the following is your dopamine agonist? Is it your ropinirole, rotigotin, pramipexole, or all of these? Chalo, come on, fast. Come on. This one, you can do it. You can do it, guys. Simple. Very easy. Yeah, come on. Memantine, exactly. Memantine. Yeah, this is your all of these. Exactly. Very nice. And a dopamine agonist, ropinirole, rotigotin, as well as pramipexole. Very much useful in Parkinson disease, right? And what is the relationship of dopamine with prolactin as well as in growth hormone? Tell me, what is the relationship between dopamine and prolactin and dopamine growth hormone? Tell me, what's that? What's that? Tell me, guys. Come on, come on, come on, come on. Till then, I will be going ahead. Okay, shall. Clinical jaundice is associated with elevated level of simple. Clinical jaundice, clinical jaundice is associated with elevated level of serum lysozyme, serum bilirubin, serum creatinine, or all of the above. Yeah. So inversely proportional. Yes. Dopamine is inversely proportional to prolactin. Yeah. Dopamine is inversely proportional to inverse. Okay. Yeah. Inversely proportional to prolactin and direct proportional to growth hormone. Very good. Very good. Very nice. Here we have obviously serum bilirubin. Serum bilirubin. Right? Serum bilirubin. Now tell me there is a one another. There is a one another term. Tell me about this one. That serum bilirubin, if increases in brain, if increases in brain, what it will be termed as? What it will be termed as? Chalo, come on. Dopamine, GH1 growth hormone, yes, and inversely proportional to prolactin. Yes, exactly. Anna, what's going to be termed as? This one, serum bilirubin. Serum bilirubin, yeah, that is your connectors. Very good, Shraddha. Anna, connectors. Very nice. Brain jaundice. Very good. Connectors. And sulfonamides are the ones which can cause this connectors. Very good. Now this one. From the following, which is neurodegenerative disorder? Gout, glaucoma, Alzheimer, or myasthenia gravis? Yeah. Come on, guys. Come on. We want other persons as well to communicate over here, right? Chalo, let's go over here. Now, gout, glaucoma, Alzheimer, or myasthenia gravis. Yep, this is your Alzheimer's only. है ना? There are many other neurodegenerative disorder as well. Parkinson, है ना? Huntington disease, right? Your epilepsy, right? Also, if I talk about mania, depression, right? ADHD, attention deficient hyperactivity disorder, right? All those are neurodegenerative disorders. Very good, very good. Now this one, human chorionic होता है, not chronic. Gonadotropin hormone is secreted by what? Placenta, ovary, testis, or all of the above. Chalo, tell me this one. Ovaries, placenta, testis, or all of the above. Come on. Human chorionic gonadotropin hormone, that is also, you can say, used to uh, find the pregnancy, to check the pregnancy, right? So pregnancy kit, that is your placenta over here. So placenta is going to be your correct answer. Simple. Now this one. Which of the following is GABA B agonist? Okay, GABA B agonist. Is it a baclofen, cyclofen, picoculin, or benzodiazepine? Which of the following is GABA B agonist? Is it your baclofen, cyclofen, picoculin, or benzodiazepine, guys? Yeah. So GABA B, GABA B agonist, that is your baclofen, right? And if I talk about antagonist, then it will be your cyclofen, right? GABA B receptor, that is considered to be as your GI mediated coupled receptor. GI mediated coupled receptor. If I talk about GABA A, then it is your ligand gated ion channel chloride mediated ligand gated ion channel. All right. Chalo, let's go ahead now. Which is longer acting penicillin? Is it your procaine penicillin, benzathine penicillin, penicillin V, or ampicillin? Yeah, come on. Procaine penicillin, benzathine penicillin, penicillin V, or ampicillin? Hmm. So those drugs which are known to be as repository in nature, those repository penicillin, okay, those penicillin which are repository in nature, these are always going to be our longer acting drug, right? So benzathine penicillin is your one of the repository penicillin, which has been very much useful over here, right? Here you can see a repository. So penicillin, procaine penicillin G, right? Procaine penicillin G, benzathine penicillin, 45 protein penicillin, as well as sodium penicillin G. These are your repository ones. Okay, now this one. All right. GABA B receptors. GABA B receptor reduces chloride ion conductance, increase chloride ion conductance, increase CAMP and conductance of Ca calcium. Okay. Decrease CAMP and conductance of calcium. Come on. Easy. Easy, 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 easy. Come on, fast. Somnath saying B. Okay. Anybody else? Anybody else? Sali Krishna says B. Okay. Somnath says D. Yeah, exactly. That's going to be your D. Decrease CAMP. Why? Why? As I just told you, GABA B is your GI mediated. This is not ligand gated ion channel. No, this is not. If this would be ligand gated ion channel, then this going to be happen. But this is GI. GI has a correlation with decrease CAMP levels. The decrease CAMP level and conductance of calcium will also be decreases, right? Okay. Now the hormone that lowers CAMP concentration in liver cells is known to be as what? Yeah, the hormone that lowers CAMP concentration in liver cells, is it your glucagon, insulin, epinephrine, or thyroxine? Come on. Yeah, that is simple, but insulin, right? Insulin is going to lowers down the CAMP concentration. Very nice. Now this one. Calcium channels in heart are of which type? Calcium channels, ligand gated L type, what's the difference between this one? So obviously L type calcium channel are always there, right? Chalo. Now dyspnea. What is dyspnea? Increased respiratory rate, reduced respiratory rate, irritation of bronchial smooth muscles, or breathlessness, difficulty in breathing. Yeah, come on, come on, come on, come on. This one, simple. Dyspnea, dyspnea, breathlessness, difficulty in breathing, right? Breathlessness, difficulty in breathing is going to be your correct answer over here. Yeah, chalo. Now, morphine shows its action by acting on which receptor? Yeah, morphine shows its action by acting on which receptor? Is it your mu receptor, mu and gamma, kappa and delta, or gamma and mu? Which one is it? Yeah, come on, come on. That's your mu over here, right? Morphine shows its action by acting on the mu receptor. All right, now this one. Which of the following is false neurotransmitter? I don't know how many times I have told you in the classes as well. That is, this is known to be as false neurotransmitter. Which one? Epinephrine, beta methyl dopa, alpha methyl dopamine, or dopamine? Yeah, which one? False neurotransmitter. False neurotransmitter. Come on. False neurotransmitter. That is your C, right? Alpha methyl dopamine. Exactly, Somnath. Silver, okay. Anil Kumar, okay. Mahalakshmi, yes, exactly. Now this one. NSAIDs decrease the synthesis of IgM rheumatoid factor. This is important, by the way. This is important and quite unique question. Here you can see. NSAIDs decreases the synthesis of IgM antibody rheumatoid factor through piroxicam, ibuprofen, aspirin, or sulindac. Chalo, come on. Piroxicam, ibuprofen, aspirin, or Sulindac. Yeah, this is going to be your piroxicam, right? Enolic acid derivative. Piroxicam, tanoxicam, right? Okay, now this one. Which of the following beta blocker have reduced risk of bronchospasm? Reduced risk of bronchospasm. Yeah, reduced risk. Propanolol, atenolol, pindolol, or none of the above. Yeah, simple, simple. Those drugs which will be cardioselective, those drugs which will be cardioselective in nature, right? This will not have any bronchospasm. And I told you that the drugs starting from A to M are considered to be as a cardioselective drugs, and those drugs acting onto the beta 1 receptor only. Beta 1 receptor only, right? So that's why atenolol becomes your correct answer, which is your cardioselective drug, atenolol, right? Chalo. Very good. Now this one. Mesna is used for reducing the side effects of which anti-cancer drug? Same question that was asked in your GPAT 2026. Yeah. Is it your vincristine, cyclosporin, cyclophosphamide, asparaginase? Come on. Come on. Come on. So this is your last question of pharmacology over here. Then we'll be starting pharmaceutical jurisprudence. Yeah. Mesna is used for reducing the side effects of which anti-cancer drug? Vincristine, cyclosporin, cyclophosphamide, or asparaginase? Simple, right? Cyclophosphamide. Very nice, champion. Cyclophosphamide. And it can cause what? Hemorrhagic cystitis. Hemorrhagic cystitis, right? It can cause hemorrhagic cystitis, and that is what prevented by Mesna, right? Chalo, very good, very good. Okay, okay. Now this is the end of pharmacology section. Now let's move on to the pharmaceutical jurisprudence over here. All right, let's go ahead now. Okay, which of the following is Regulatory Authority of Australia? Regulatory Authority of Australia. Is it your PMDA, Pharmaceutical and Medical Devices Agency? Yeah. Medicines and Healthcare Products Regulatory Agency? TGA, Therapeutic Goods Administration, or CDSCO? Chalo, come on. Simple. Yeah. Pharmaceutical jurisprudence. We have. Which of the following is Regulatory Authority of Australia? Is it your PMDA, MHRA, TGA, or CDSCO? Yeah. This is going to be your Therapeutic Goods Administration, TGA. CDSCO for India, right? Chalo. Minimum numbers of partners required for opening an industry are partners. Okay, so who will be the partner? At least how much number should be there to become a partner? Obviously, it should be two only. One will not be become a partner. No, that will be a owner only. Two, if the persons are there, then it will be having two partners. Okay, so that will be a partnership over there. So two is going to be your correct answer. Simple. Yeah. Now this one. List of diseases that a drug should not claim to cure is given in which schedule? Schedule L, Schedule L, Schedule J, Schedule K, or Schedule H? Yeah. Come on. Yeah. Schedule L, Schedule J, Schedule K, or Schedule H? D. How D? That was a previous one. Wala D. Okay. Now this one. This is going to be your Schedule J, right? Schedule L for GLP, good laboratory practice. Schedule J for these drugs not to claim cure in given schedule, and that also have Magic Remedies wala Act, right? Magic Remedies Act, and 1954, if you remember. Schedule K, um, the drug which has been the drug which has been uh, exempted for the manufacturing, right? That is your Schedule K, and H for the prescription drugs. H for prescription drugs. Okay? Sure. Now this one. Sera vaccine antigen antitoxin test and rabies research are performed in Central Research Institute, CRI. Okay, CRI is located at Kasauli, Kolkata, Delhi, or Mumbai. Yeah, come on. Yes, CRI. CRI is located at Kasauli. Yes, Kasauli is in Himachal Pradesh. Himachal Pradesh. Right, Kasauli. A very beautiful place it is. And Kolkata, Delhi, Mumbai. Okay. National Institute of Communicable Diseases is located at at the starting itself. At the starting itself, I told you one thing. National Institute of Communicable Diseases is at New Delhi, Gujarat, Maharashtra, or Himachal Pradesh. Where is it? Where is it? New Delhi, Gujarat, Maharashtra, Himachal Pradesh. As I told you, that is your New Delhi is going to be your correct answer over here, right? New Delhi is your National Institute of Communicable Diseases. That's your New Delhi. Somnath, yes, exactly. Mahalakshmi, very good. Farmer profession, very good. Now this one. National Institute of Homeopathy is situated at. National Institute of Homeopathy is situated at. That's your Mumbai, Kolkata, Delhi, or Jaipur. Tell me this one. National Institute of Homeopathy is situated at Mumbai, Kolkata, Delhi, or Jaipur. Yeah, which one is it? National Institute of Homeopathy is situated at Mumbai, Kolkata, Delhi, or Jaipur. Yeah, very nice. That's your Kolkata. Very good. Sai Krishna. Yep. RBI was established in. RBI was established in April 1, 1934, April 1, 1935, April 1, 1937, April 1, 1949. Yeah, come on. That is your April 1, 1935. Okay, chalo. NVISA is a regulatory body of NVISA. NVISA is a regulatory body of USA, Japan, Brazil, or Canada. Yeah, come on. NVISA is a regulatory body of USA, Japan, Brazil, or Canada. Huh? This one, simple. NVISA is for your Brazil, right? Brazil is a regulatory body having NVISA, right? Chalo. Now let's go to the pharmacognosy over here. Alright, chalo, let's go right now. Now this one, central element present in the structure of chlorophyll. Is it going to be your iron, magnesium, cobalt, or manganese? Central element present in the structure of chlorophyll. Structure of chlorophyll. Is it your iron, magnesium, cobalt, or manganese? Come on. Which one is it? Yes. Huh? That's your magnesium. Very good, Sai Krishna. Very nice. Magnesium. Very good. Very good. Now this one. A glycoside is the carbohydrate form of one. Is it your ether, acetyl, aglycone, or alcohol? So you know that's your glycone as well as aglycone moiety. Right? Glycone moiety as well as aglycone moiety. So glycone moiety is also known to be as your acetyl, right? Acetyl. Okay. Now this one. Which of the following is 15 carbon intermediate in mevalonic acid pathway? Is it your geranyl pyrophosphate, faranyl pyrophosphate, 3,3-dimethyl allyl pyrophosphate, or squalene pyrophosphate? Yeah, come on. A-glycone is a non-sugar moiety, Sai Krishna. Okay, this one, 15. Yeah, 15 is going to be F for 15, F for 15, and F for farnesyl. Farnesyl pyrophosphate. Exactly. Mahalakshmi. Very good. Anna, that is your correct answer. Farnesyl pyrophosphate. Yeah. Now this one. Rancidity of vegetable oils can be reduced by adding what? Rancidity. Okay, rancidity. So, viscous, viscosity builder, preservatives, vehicle, or antioxidant. Which one is it? Which one is it, guys? Rancidity of vegetable oils can be reduced by adding viscosity builder, preservatives, vehicle, or antioxidant. Yeah, that's your antioxidant. Very good. Pharma profession, Sai Krishna. Very good. Varalakshmi. Very nice. That's your antioxidant. Okay, now this one. Indole alkaloid are derived from which amino acid? Is it your tyrosine, tryptophan, lysine, or ornithine? Come on. Indole alkaloids are very much important, guys. Anna, these are having what? Huh? Physostigma? Physostigma? Uh, physostig stigma, right? Anna? R for Rolfia, Rolfia, and O for opium, right? Opium, and V for Vinca, right? These are the ones. And here we have tryptophan over here. That is your indole alkaloid. Tyrosine, we do have in your quinine alkaloid. Okay. Quinine alkaloid. Ornithine, that is for your tropane alkaloid. Tropane alkaloid. Okay. Remember this one. Tropane alkaloid. Rapontic rhubarb shows a which fluorescence in ultraviolet light? Is it your blue fluorescence, green fluorescence, violet fluorescence, or brown fluorescence? Rapontic rhubarb. Rapontic. Blue fluorescence, green fluorescence, violet fluorescence, or brown fluorescence. Simple. That's your blue fluorescence, right? Blue fluorescence is going to be correct answer. Now this one, the intermediate in the biosynthesis of anthraquinone glycoside is what? Shikimic acid pathway, malonic acid pathway, mevalonic acid pathway, or malonyl coenzyme A. Melony. Melony. Melody. Melony and melody. इतनी चॉकलेटी क्यों है? या shikimic acid pathway, kishmish acid pathway, shikimic acid pathway. That's your anthraquinone glycoside. Okay. So now let's talk about the biochemistry over here. What is the function of RNA primer? Okay, primer are used to do what? Primer are used to initiate something, right? Initiate the replication. Hana? So what is the function of RNA primer? Initiation of new DNA synthesis, replication, separation. Huh? The two stand. DNA synthesis from 5 to 3 direction. It produces Okazaki fragments. Yeah, come on. Simple. That's your exactly Mahalakshmi. Initiation of new DNA synthesis, replication. Exactly. Now this one. Which of the following is not a cloning vector? Cloning vector. Which is not a cloning vector? Is it your agrobacterium, yeast, neurospora, or bacteriophage? Is not a cloning vector. You can do the cloning in agrobacterium. Yes, you can. Yeast, yes, you can. Bacteriophage, you can. But neurospora, no, you can't do the cloning in your neurospora over here. Okay, so this is important to understand. Now this one. In Michaelis-Menten equation, Vmax is a measure of what? Substrate affinity, coenzyme activity, catalytic efficiency, or cofactor affinity. Come on. Substrate affinity, coenzyme activity, catalytic efficiency, cofactor affinity. Yes. That's your catalytic efficiency. Very good. No, substrate affinity, no. Substrate affinity, that is your Km, Sai Krishna. Anna, substrate affinity, that is your Km value. If I talk about catalytic efficiency, that is what Vmax over here. Okay, remember this one. Now this one, which of the following fatty acid is biosynthesized by human body? By human body. Linoleic acid, oleic acid, linoleic acid, or all of these is biosynthesized by human body. Yep. Human body. That is your non-essential fatty acid. I'm talking about non-essential fatty acid. That is your non-essential. That is your oleic acid, right? Whereas essential are your LLA, linolenic acid, and A for arachidonic acid. Non-essential is your oleic acid, guys. Understand the difference. Which of the following is your keto sugar? Okay, keto sugar, xylulose, talose, ribulose, or allose. Simple, right? Simple. Wherever you will see ribulose, you will be having your keto sugar as a identification mark. That is your ribulose over here. All right. Now this one. Which sugar does not cause muta-rotation? Muta-rotation, is it your sucrose, lactose, fructose, or maltose? Muta-rotation. Muta-rotation. Come on. This one. Yes. Sucrose, lactose, fructose, or maltose? This is your sucrose. Exactly. Sucrose doesn't show any kind of the muta-rotation. Very nice. Cori cycle. Yes. Cori cycle is what? Cori cycle transfers glucose from muscles to liver, lactate from muscles to liver, lactate from liver to muscles, pyruvate from liver to muscles. Cori cycle is also known to be as your intermediate cycle, if you remember. It is also known to be as your intermediate cycle, right? Anna. So that do what? That usually do lactate from muscles to liver, right? Now, which of the following is disaccharide reducing the contain beta 1,4 linkage? Beta 1,4 linkage. Yeah, come on. Beta 1,4 linkage. Beta 1,4 linkage would be your lactose over here, right? Lactose is going to be your correct answer. Simple. Sure. Now, pharmaceutics as well as allied subjects, right? Okay. Pharmaceutics as well as allied subjects you need to have. Okay, now this one. Which of the following is not a part of 4P of marketing? 4P of marketing. Product, promotion, purity, or price. Not a part of 4P of marketing. Is it your product, promotion, purity, or price? Which one is it? Hmm? Come on. This is your C. Exactly. Purity would not be a 4P of marketing. Yes. Now, 51 bank account is an example of. 51 bank account is an example of nominal account, personal account, real account, or none of these. Yeah. This one. 51 bank account is an example of nominal account, personal account, real account, or none of these. This is going to be your personal account. Okay. Now this one, the price that equates market supply and market demand is called as market restoring price, market depreciating price, market elasting price, or market clearing price. Which one is it? Which one is it? Yeah. Market restoring price, market depreciating price, market elastic price, or market clearing price. Anyone? That's your market clearing price. Very good pharma profession, right? Very nice. Okay, now this one. The tenders which are called by advertisement are known as, which are called by advertisement. Is it your open tenders, limited tenders, simple tenders, or oral tenders? Yeah, open tenders, limited tenders, simple tenders, or oral tenders. Which one is it? That's your, that's your. open tenders, right? Simple. Now, the art of planning, organizing, staffing, motivating, and controlling is called as what? Manufacturing, advertising skills, management, or marketing. Simple. Very simple question. Very simple question over here. Very simple. Yeah, come on. The art of planning, organizing, staffing, motivating, and controlling is called manufacturing, advertising skills, management, or marketing. Which one is it? That is your management. Very good. Very good. Pharma profession and Mahalakshmi. Very good. Now this one. Which was the first Indian company to develop dihydrogesterone? Dihydrogesterone. Is it your Sun Pharma, Glenmark, Mankind, or Alembic Pharmaceuticals? Yeah. Which are the first Indian company to develop dihydrogesterone? Is it your Sun Pharma, Glenmark, Mankind, or Pharma? That is your Mankind Pharma, guys. Okay, very good. Now, span 40. Okay, span 40 is chemically what? If you remember, LPSO, right? Laurate, palmitate, right? Uh, I lost foliate and stearate. Yeah. So 20, 40, 60, and 80, right? The 40 would be your palmitate, sorbitan mono, palmitate over here. Okay. LPSO you have to remember. LPSO. Okay. So LPSO to sorbitan mono, palmitate, that's your span 40. And if I talk about the twin 40 then, if I talk about twin 40, then it would be your polyoxymethylene sorbitan, polyoxy ethylene, sorbitan, monopalmitate, that would be your twin 40. Okay, now this one. The size of mesh screen in USB disintegration device is 10, 20, 30, or 40. Simple, yeah. Very simple. Very simple. The size of mesh screen in USB disintegration device is your 10, 20, 30, or 40. And also tell me about in IP. What's that? What's that in IP? Hmm. Yeah. This is your 10, by the way, right? Sudhanshu, yes. Sudhanshu, very nice. Anna, that's your 10. And what about in IP? What about in IP? Okay, now this one. Bioequivalence denotes two drugs products having what? Same pharmacological activity, same rate and extent of absorption, same amount of drug with different excipients, same amount of drug with similar excipients. Simple, guys, simple. Same pharmacological activity, that would be your therapeutic equivalence. Therapeutic equivalence. That is not bioequivalence. Therapeutic equivalence. Same rate and extent of absorption? Yes, exactly. B is going to be your correct answer. That is what the definition of bioavailability, the same rate and extent of absorption, that is a bioequivalence, right? Simple. Now, under BCS class 1 are having what? High solubility and permeability, low solubility and permeability, high solubility and low permeability, low solubility and high permeability. What's that? What's that? High solubility and permeability, low solubility and permeability, high solubility and low permeability, low solubility and high permeability. So, solubility, permeability, Hana, you have to do this one, solubility, permeability. Okay. Solubility and permeability. In class 1, high, high. In class 2, low, high. In class 3, high, low. And in class 4, low, low. Right? So A is going to be your correct answer, right? Now this one. Which among the protective colloids have greater protection action? Greater protection action. Okay. Gelatin, albumin, tragacanth, or gum arabic. Okay. The lesser the gold number, lesser the gold number, greater will be the protective action, if you remember, right? Anna? Greater number be the protective action. So is it going to be your gelatin, albumin, tragacanth, or gamma arabic? Which one is it? That is your gelatin, obviously. Okay, chalo. The instrument used to measure particle size. Simple. Particle size. Is it your Coulter counter, softometer, tonometer, or osmometer? Yeah. Which one is it? Coulter counter, soptometer, tonometer, or osmometer? Yeah, that is going to be your Coulter counter, and the mechanism is decrease in decrease in resistance, right? Decrease in resistance. You have to see that is your the mechanism of Coulter counter. Okay. Also, you can see particle volume as well. Volume, particle volume. Also, you can identify through Coulter counter. Okay. Tonometer is for the osmotic pressure. On this one, cetyl ether of polyethylene glycol hexadexyl ether is known as what? Okay, this one. Cetyl ether of polyethylene glycol hexadecyl ether is known as Mirj 56, Bridge 56, cetomacrogol 1000, or all of the above. Obviously, if you see cetyl over here, the cet, and a macrogol, glycol, microgol, as well as 1000. So C is going to be your correct answer over here. Yeah, chalo. Free NIPER batch test, guys. You are here over there, and a daily practice test is there only. Useful for all the NIPER institute, obviously, just for your NIPER examination as well. Okay, chalo. How to join? Just click onto this one, GDC classes app, install, plus the icon button. Free material will be given. Sorry, plus icon will be there, and you have to just enroll the NIPER 26 batch, and then you will be joining the test series over there. Okay, on this one. Which type of USP dissolution apparatus are used for oral tablet testing? Oral tablet testing, type 1, type 2, type 3, type 4, type 5, type 1, type 7, or none of the above? Yeah, this one. Which type of USP dissolution apparatus are used for oral tablet testing? Type 1, type 2, type 3, type 4, type 5, type 1, type 7, or none of the above? Sudhanshu says A, that's your type 1 as well as type 2, right? Basket as well as paddle. Basket and paddle are useful for your oral tablet testing product. Okay, very nice. Now, particle size obtained from a fluid energy mill is what? 1 to 30 picometer, 30 to 60 picometer, 60 to 90 picometer, 90 to 120. What's that? JUM. That is going to be your what? Aha, Sai Krishna, that's not 157, 157. It's A only. Over here, this one is your 130 picometer. Okay. Chalo. Which of the following is your biodegradable polymer? Biodegradable polymer, which can be reused again. Not reused again. Biodegradable means it can be degraded in your nature as well. It doesn't cause any kind of the toxicity into the nature. That's your chitosan, polyglutamic acid, mannan, or all of the above. Come on. That's your hmm, all of the above. Okay. No form profession is all of the above. Okay, DL Vivo theory is associated with simple, very much simple. DL Vivo theory, granulation, suspension, emulsion, or compression. DL Vivo theory. It's not therapy, by the way. It's theory. Theory is associated with granulation, suspension, emulsion, or compression. Yeah, that is your B, suspension. Very good pharmacopoeia. Very nice. Identify non-ionic surfactant. Non-ionic surfactant. Sodium lauryl sulfate, spans, benzalkonium chloride, or lecithin. Sodium lauryl sulfate, these are your anionic, right? Benzalkonium chloride, that's your cationic. Non-ionic is your spans as well as twins, right? Spans as well as twins, these are your non-ionic surfactant. Okay. Lecithin is your neutral ones. Lecithin is your neutral. Now this one, if the angle of repose of the given powder is between 40 to 45, the type of flow is what? Excellent, good, passable, or very poor? Yeah, excellent, good, passable, or very poor. Hmm? Obviously, that is going to be your passable over here, right? Chalo. Chemically, Newjol. Newjol is what? Newjol is what? Geminal diol, polyhydric alcohol, liquid paraffin hydrocarbons, or terpene. What's that? Newjol. Chemically, Newjol is what? Geminal diol, polyhydric alcohol, liquid paraffin hydrocarbons, or terpene. Mahalakshmi says C. That's your liquid paraffin hydrocarbon. That's your C over here, right? Chalo. Which of the following is your directly compressible polymer? Okay, chalo. This one is simple, right? This one is simple. Is it your polyvinyl pyrrolidone? AV cell, that's your microcrystalline cellulose, ditab, and HPMC, hydroxy propyl methyl cellulose. What's that? Compressible polymer. PVP, AV cell, ditab, or HPMC. That is your AV cell, that is your microcrystalline cellulose, MCC, considered to be as a directly compressible polymer, right? So, Fitzpatrick commuting machine. Okay. Fitzpatrick commuting machine is a variance of mill. Which mill? Is it your pin mill, ball mill, hammer mill, or roller mill? Yeah. Pin mill, ball mill, hammer mill, or roller mill? This is going to be your hammer mill. Okay. Now let's move on to the microbiology. Microbiology over here. Okay. Let's go ahead now. The process of eliminating the plasmid from bacteria is known as. Okay. The process of eliminating the plasmid from bacteria is known as conjugation, transduction, mutation, or culling. Yeah, anyone? That's a simple one. That's a simple question over here. Yeah, the process of eliminating the plasmid from bacteria is known as conjugation, transduction, mutation, or culling. Yes, this is your. No one is ready to answer, huh? That's your culling, guys. Very simple. Yeah, Mahalakshmi, very nice. L-asparaginase is obtained from. Chalo, this is also simple. L-asparaginase is an enzyme which is your also anti-cancer drug, which is your anti-cancer having property, right? Through E. coli, Streptomyces pivitis, Streptomyces verticulus, or none of these. Simple as well. This one. Yeah, L-asparaginase is obtained from E. coli, right? Now, single-stranded DNA virus is known as adenovirus, reovirus, parvovirus, or none of the above. Come on, fast. Guys, do reply. Do reply over here. Single-stranded DNA virus is known as what? Adenovirus, reovirus, parvovirus, or none of the above. That's your parvovirus, guys. Chalo. The characteristic shape of the bacteria is maintained by because of capsule, cell wall, cell membrane, or slime layer. What's that? Chalo, last question of this one. Last question, and after that, Akhilesh sir will take on from here. Akhilesh sir will take on from here. The characteristic shape of the bacteria is maintained because of capsule, cell wall, cell membrane, or slime layer. What's that? What's that? Yeah, that is true. True. Cell wall, guys. Cell wall. Okay, chalo. Very nice. Mahalakshmi and Pharma Profession, very good. Okay, guys, thank you so much for being with me over here. And don't go anywhere. Akhilesh sir is joining with you all guys, just right now. And he will be taking your organic chemistry and other chemistry part as well, medicinal chemistry, inorganic as well as physical chemistry. All right. Wishing you all the very best and do come tomorrow as well at 10 a.m. on a regular basis, and we'll be solving again the model paper 2 tomorrow at 10 a.m. All right. Thank you so much. And please do like this video, live session, so that we can get some also things over here. Okay. Thank you. Thank you so much. Thank you so much. Akhilesh sir is going to be taking the live. All right. Chalo. Wait for a minute, guys. Do like this session, by the way. Okay, fine.
Yeah, okay, so good afternoon, everyone. Good afternoon, good afternoon. All right, so now after the pharma portion, like ecology, sutics, it's time for the chemistry as well. So, welcome back once again. Here we are in the 20 days, 20 model paper. And this is the first model paper discussion. And in this 2 days now, in my part, we will be discussing the questions that we have seen from the pharmaceutical chemistry. So, pharmaceutical chemistry, that is one of the most vast subject for your NIPER examination. As you can say, we are having nearly 20 to 25 questions from this alone pharmaceutical chemistry portion, consisting of all the chemistry portions like organic, inorganic, medichem, and the analytical portion. So if we are having all these, then that is important for us. And 25 questions is itself saying like, okay, this subject is having so much weightage of. All right, so let's get started for today's session now on the pharmaceutical chemistry. All right, so let me confirm you all, like this is the first model paper, and today we have seen this model paper discussion was started from the 12 a.m. or you can say 12 p.m. but not in the tomorrow's class. We will be having this at 10 a.m. The session will be starting from the 10 a.m. only. All right, so let's have the first question. So we are having the first question, that is pharmaceutical chemistry, that is regarding the pharmaceutical chemistry. So let's have the first one. Let's have the first question of this session, that is what is we are having, which of the following organic compound undergoes Friedel-Crafts reaction. All right, just a second, I guess we are having something issue here. Just a moment. All right, for the English batch we are having this one. For the English we are having this one, my bad. This is for the English. Okay, so let's get started with the pharmaceutical chemistry and the allied subject. And the first question that we are having is, which of the following organic compound undergoes Friedel-Crafts reaction? So you have seen 83 question from the other pharma portions, and now we are having this question. So what is the right answer for this question? Which of the following inorganic compound will be undergoing the fastest Friedel-Crafts reaction? Or you can say like, okay, Friedel-Crafts reaction, it means they must be following the electrophilic aromatic substitution kind of reaction. These reactions are occurring only and only on the aromatic ring system. So all those aromatic rings that are here, they must be having chances for the Friedel-Crafts alkylation reactions. Aryl halide, all right, so this aryl halide, it means it is having aromatic ring. Vinyl halide, not at all. Just like this one, this is a vinyl halide. 2-dimethyl propyl halide, no, that is also not having any kind of aromatic ring. All of these, no, that is incorrect. So the right answer for this question is the aryl halide. So the A option, that is aryl halide, is the correct answer. Like, okay, the aromatic ring that is present here can have this reaction, like we are having this one. And if we do under the presence of AlCl3, we are having CH3Cl, then we will be getting, then we will be having the right answer, that is either we are getting this one or we are having this one. So alkyl group is actually substituting hydrogen from the aromatic ring, and we are getting these kind of products, so ortho or para alkylated product. And suppose we are having the acylations like CH3 COCl, then we will be having under the presence of AlCl3 the acylating product, that is the ketone derivative. Either here, either we are getting the product acylations at this position or at here C double bond O Cl, this position. So this is Friedel-Crafts acylation, this is Friedel-Crafts alkylation. All right, so the A option A is the right answer. Option A, that was the right answer. Cyclic ketones are converted into cyclic esters. So we are having this cyclic ketone, and this is converted into what? So this gets converted into cyclic esters. So what is this all about? So this reaction must be happening only under the presence of any peroxy acid. So we must be having a peroxy acid. Under the presence of peroxy acid, this cyclic ketone is converted into cyclic ester, that is known as lactones. So this reaction is known as what? So under the presence of peroxy acid, any ketone can be converted into esters, and this reaction is known as what? This reaction is known as 𝑎𝑒r-Williger oxidation reaction. This is a 𝑎𝑒r-Williger oxidation reaction. So benzylic, no Beckmann. This Beckmann was in our GPAT 2026 paper. Beckmann rearrangement, that is conversion of a oxime into amide under the presence of acid. Yes, that is a 𝑎𝑒r-Williger oxidation reaction. So option C, that is the right answer for this question. Option C is the correct one. Option C is the correct one. All right, so the next question that we are having here is what? We are asked about the bond angle in case of water molecule. So what will be the bond angle in the water molecule? In the case of water molecule, what is the bond angle we are having? What is the bond angle we are having? Water molecule, that is H2O. Okay, so let's have the structure of H2O, that is this and this. So oxygen are having two lone pairs. So let me draw the lone pairs of the oxygen as well. And this is a sp3 hybridized atom. Oxygen is having sp3 hybridizations. This is your ammonia. This is having pyramidal structure. This is also having sp3 hybridization, and this one is your methane. This one is the methane. All right, this is also having sp3 carbon. So all the central atoms like carbon, nitrogen and oxygen are having sp3 hybridizations, and for the ideal case, when all the four bond pairs are there in a central atom, the hybridization is sp3. Ideal bond angle for sp3 is 109 degree, 25 minute, 27 second. All right, so what is the ideal bond angle? That is the 109. You can say, okay, this is your ideal bond angle for a sp3 hybrid carbon or any sp3 atom, central atom. 107, when we are having lone pairs, when the number of lone pairs increases, the bond angle decreases. Bond angle decreases. Because of one lone pair, the bond angle from 109 decreased to 107 degree. And here in this case of water, as the bond angle, number of bond angle increased to 2, the bond, the number of lone pair increased to 2, the bond angle decreased more, and now this becomes 104.5 for the water. So for the ammonia, we are having 107. For water, that is 104.5. That is also, you can be telling like, okay, this is 105 degree. And for the carbon, that is 109 degree, 28 minute, 27 second. All right, so for the water, it has to be 109. What is the bond angle? 120. This is regarding the sp2 hybrid atom, which are having the planar structures. They are having the planar structures. Okay, which of the following bonds is the weakest bond? So which is the weakest bond? Coordinate bond, the bond that is also called as dative bond. These are also named as dative bonds. Dative bonds. All right, so in this case we are having what? In this case, we are having, when a covalent bond is formed between two atoms and the electron sharing is done by only a single atom, not both, that is the coordinate bonds. This case is known as the coordinate bond. So here in this case, dative bond, coordinate bond, this is a kind of covalent bond. All right, covalent bond, sharing of electron, it means these are also stronger bonds. Hydrogen bonding interactions. They are having bonding interactions. Van der Waals forces. So these van der Waals forces of attraction, these are just forces of attraction. No bonding is present in the case of van der Waals. These are just force of attraction between two atoms. So this is not any kind of bonding. So the weakest bond, it has to be the van der Waals. Van der Waals forces of attraction. These are just forces of attraction. So van der Waals are not any kind of bonding phenomena. But yes, hydrogen, they are bonding phenomena, but they are of a very lower energy. But no, hydrogen is also a kind of bonding interaction at least. Covalent, these are stronger bonds. Coordinate bonds are also stronger. They are in the complexations. We see, okay, they are having the coordinate bond formations only, but the van der Waals forces of attraction, these are just forces of attraction. No bonding phenomena, no bonding kind of phenomena are present in such cases. Which of the following is not a use of ammonium chloride? So we are having ammonium chloride, NH4Cl. Ammonium chloride, according to inorganic pharmaceutical chemistry portion, ammonium chloride is a systemic acidifier. This is a systemic acidifier, and if it is a systemic acidifier, this must be having increased in acidity in the blood, you can say. All right. Ammonium chloride. Ammonium chloride is also an excellent expectorant. This is having excellent expectorant properties. All right, excellent expectorant properties is present in the ammonium chloride in the case of ammonium chloride. And the next one regarding the NH4Cl, that is this, because of his systemic acidifier property, this is an excellent diuretic as well. This is a diuretic. What about antihistaminic? No. Ammonium chloride is having no any role in the case of blocking the histamines. So no antihistaminic property is present in these cases. So that is why this is having not any use in the antihistaminic. But yes, that is a diuretic agent. It is an expectorant. It is an acidifying agent. What kind of acidifying? Systemic acidifier. What about the gastric acidifier? Dilute hydrochloric acid is known as the gastric acidifier. So this antihistaminic is not any property of ammonium chloride. So the correct answer, it has to be the antihistaminic. Antihistaminic. This is going to be the right answer for this question, for this given question. All right. Moving to the next, we are having what? What is the common name of a chlorinated lime? So the common name of chlorinated lime. All right. So we are having what? Okay. Baking powder. Let's start from here. This is what? Sodium hydrogen carbonate. Sodium hydrogen carbonate. That is also known as cooking soda, baking soda, meetha soda, something like this. And this is a antacid. It's a systemic antacid. This is a systemic antacid. All right. This one is systemic antacid. Okay. Blue vitriol, that is CuSO4. The copper sulfate is known as what? Blue vitriol. And this copper sulfate is also having emetic properties. This is a emetic. This is an emetic agent. White vitriol, this is what? This is ZnSO4. That is zinc sulfate, ZnSO4. So the ZnSO4, that is white vitriol. White vitriol. And this ZnSO4 is a astringent. This is having astringent properties. All right. Astringent properties. Now what about bleaching powder? This bleaching powder is CaClOCl. This is your bleaching powder. So yes, the correct formula is CaOCl whole twice, Cl twice, Cl2. This is bleaching powder, that is also known as chlorinated lime. Chlorinated lime. Except this, we are having blue and white. Now, the green vitriol. What is the green vitriol? Green vitriol is the FeSO4, that is also known as ferrous sulfate, a hematinic agent. FeSO4, green vitriol, that is used as a hematinic agent. Hematinic agent. Okay. Hematinic agent. Now what about the red vitriol? Red vitriol, that is the cobalt sulfate, COSO4, that is known as red vitriol and red vitriol. Okay. Next one we are having is the magnesium sulfate, that is Epsom salt. Epsom salt, sometimes also known as bitter salt. Bitter salt. What is this all about? This is MgSO4, magnesium sulfate. That is a saline cathartic osmotic laxative agent. This one. Okay. And H2SO4. What is this H2SO4 known as? This is known as oil of vitriol. Oil of vitriol. So these are some common names regarding the various sulfates. H2SO4, MgSO4, COSO4, CuSO4, FeSO4. Okay, so here white vitriol, ZnSO4. These are some common names regarding so many number of compounds, so many number of chemicals. Stannous fluoride. So either stannous fluoride or the sodium fluoride. Either stannous fluoride or the sodium fluoride. These both compounds are used as a dental agent, and the correct combination, correct property for the stannous fluoride and the sodium fluoride is used, they are used as the anti-cavity agent, that is they are used in cavity protection, so they are anti-caries agent. All right, so they are anti-caries agent. Astringent we are having ZnSO4 and alum and zinc sulfate. Dental caries, yes, that is the right answer. No perfumery. Anti-dandruff, so they are selenium sulfide, selenium disulfide or selenium sulfides. Selenium sulfides, they are used as anti-dandruff. They are anti-dandruff agent. Okay, so the correct answer for the stannous fluoride, they are used as a dental caries, that is dental cavity agent. They are used in protection of dental cavity. 𝙂𝙎 apparatus is used for the limit test of. So the 𝙂𝙎 apparatus. Now we are having one of the questions that we have seen from the 𝙂𝙎 apparatus just now in this year of GPAT examination. There was a question called what? Internal diameter. So they asked about the internal diameter of the tube that we have seen in the 𝙂𝙎 apparatus. What was the size? It was 6.5 mm internal diameter of the tube. So this 𝙂𝙎 apparatus is used for the limit test of arsenic, and arsenic impurity is present in the form of arsenic acid that is reduced into, first of all, arsenous acid, and the arsenous acid is further reduced into arsine gas, and the arsine gas, when that arsine gas hit the mercury chloride paper, we are having a yellow colored spot on that particular mercury chloride paper. So this is how we are having the limit test for the arsenic, and this apparatus, this setup is known as the 𝙂𝙎 apparatus. In the case of iron, we have used �thioglycolic acid. So iron impurity is present in the form of ferric ion. Ferric ion is first of all what? Ferric ion is first of all reduced into where? Ferrous ion, and after this we are having thioglycolic acid and ammonia and citric acid, and in the presence of this ferrous ion is converted into ferrous thioglycolate complex that is purple in color, and that is how we check the limit test of iron. Sulfate, in the case of sulfate limit test, we use what? Barium sulfate reagent. Now this barium sulfate reagent is having no sulfate. Alright, so barium sulfate reagent contains what? It is having three components. First component is the barium chloride, the second one is potassium sulfate, and the third one is sulfate free alcohol. And in the presence of this barium sulfate reagent, if there is a impurity of sulfate, we will be having formation of barium sulfate by reaction of the barium chloride. Now in the case of lead, we are having diphenyl thiocarbazone. So if there is a impurity of lead diathiazone complex is observed, and this is how we are having the various limit test reactions of these kind of chemical constituents. Next is enthalpy is used to measure. So the enthalpy is measured for the viscosity, no. Flow property, no, that is also not correct. Heat transfer, yes. Heat transfer, that is correct one. So if we are having any spontaneous reaction, the value of delta, change in enthalpy, it has to be in negative number. Okay, always a negative. So change in enthalpy, if it is in negative, then only we can say like the reaction is a spontaneous reaction. So heat transfer, this is the measurement. This is used to measure the enthalpy. Change in enthalpy is always in negative for a spontaneous reaction. A bond in which atoms share a pair of electrons. So a kind of bond in which atoms share a pair of electron. If the atoms are sharing electron pairs, this kind of bonds is known as what? This is a covalent bond. This is known as a covalent bond. Ionic bond, it is just kind of attraction of opposite ions. No electrovalent, that is also regarding the ionic bond only. No binary compound. All right, so B option, that is the right answer for this question. Whenever we are having the mutual sharing of electron between two atoms, and such kind of mutual sharing, we are having the covalent bond formation. This results into covalent kind of bond formations. So B option, this becomes the right answer. IUPAC name of the given compound, that is paracetamol. Paracetamol. What will be the right answer for the paracetamol's IUPAC? We are having N4-hydroxyphenylacetamide and 2-hydroxyphenylacetic acid. No, that is not acetic acid derivative, it is acetamide. Yes, so it is also having the right, but here having 3-hydroxyphenylacetamide, no. 5-hydroxyphenylacetate, no, this is also wrong in answer. So either A or C. But what is the exact answer? We are having this, that is the phenol, and with respect to phenol, we are having NHC double bond OCH3. So this is your acetamide group. This is the acetamide group, and with respect to this acetamide, we are having what? Para-hydroxyphenyl. This is your para-hydroxyphenyl ring, and this para-hydroxyphenyl ring is actually attached with the acetamide group. So that is actually your chemical composition of the paracetamol. This is your formula, and this is your structure of the paracetamol structure. So the correct IUPAC name, it has to be the 4-hydroxyphenyl. It's the 4-hydroxyphenyl and acetamide, not the 3-hydroxyphenyl. No, this is the incorrect one. So the right answer for this question is the A. A becomes the right answer for this question. All right. Option A is the correct one. All right. Before moving ahead, we are having a special announcement for all of you. As you all know, just practicing is not that important till you are having the knowledge. If you are having the complete knowledge of your subjects, if you have prepared really well, then the most important thing that comes for the best preparation is to having so many number of tests by having question practicings. GDC is offering you all 20 days, 20 model paper till the NIPER examinations. Now these 20 days, 20 model papers are going to help you out regarding what you have learned till now and where you are actually lacking something. So if you are really preparing for your NIPER examination, now this is the last time, this is the last opportunity to test yourself. These are the 20 days, 20 model papers. So try to solve the maximum model papers and have good scores in these 20 days model papers test. All right. So this was your first test discussion. I guess in the today's only we are having second model paper in your application. So you have to go and check the questions, correct each question, try to correct each questions, and then in the next day we will be having the explanation of the same questions. All right, in the YouTube. So the correct pharma section and non-pharma section division will be like this. We are having 120 questions from the pharma, and we are having 80 questions, that is 25 from the GK, 15 from the English, 25 questions from the reasoning portion, and 15 questions from the aptitude. All right. Now the next question we are having is the 𝘕𝙬𝙬 comes under the reaction. So 𝘕𝙬𝙬 reaction. So this is a cycloaddition kind of reaction. We are having 4+2 cycloaddition. Whenever a conjugated diene is reacted with a dienophile, this kind of combination, this kind of cycloaddition is known as the 𝘕𝙬𝙬 reaction. This kind of reaction is known as the 𝘕𝙬𝙬 reaction. So this is a cycloaddition kind of reaction. It's a pericyclic category. It belongs to the category of pericyclic reaction. So the A option, that is cycloaddition, will be the correct answer for this question. Predict which of the following carbocation has the highest energy. So which carbocation is having the highest energy? All right. So stability of carbocation will be inversely proportional to energy. So if we are having the highest energy, if we are asked about the highest energy, it means we have to find out the least stable one, least stable carbocation. So now find out the least stable carbocation. We are having this carbocation. So we knew stability of carbocation can be checked by first resonance, movement of positive charge, conjugation of positive charge. The second will be hyperconjugation, that is number of alpha hydrogens. So this is your carbocation. The direct carbon attached with the carbocation carbon will be your alpha carbon, and the hydrogen that are present on the alpha carbon will be your alpha hydrogen. So here we are having 2 alpha hydrogens. In this carbon we are having just 1. So in this case we are having 3 alpha hydrogens. Here this is your carbocation, this is your alpha carbon, and this is your alpha carbon. So both the alpha carbons here will be having 3 alpha hydrogens as well. So here 3, here 3. Now what about this? This is your carbocation, this is your alpha carbon. Just 1 alpha carbon is present here, and we are having just 1 alpha hydrogen. So the least stable will be this one. Why? Just because of 1 alpha hydrogen. Greater the number of alpha hydrogens, more will be the stability of that particular carbocation as well as for the radical as well. So here the least stable carbocation will be this A. This will be your least stable carbocation, and most energetic, the highest energy will be in the case of A. A will be having the highest energy. All right. Now the next we are having, consider the SN1 reaction of the tertiary butyl chloride with iodide. So we are having iodide ion, okay, here, and we are having the tertiary butyl chloride. If the concentration of iodide ion is doubled, the rate of forming tertiary butyl iodide will be. All right. So this is the SN1 reaction, correct? And the SN1 reactions are having two-step mechanism. In the first step, we are having what? Removal of the leaving group and formation of a carbocation. And in this case, that is your rate determining step. So the rate of reaction for the first order reaction depends only on the substrate molecule. And if we are having just substrate molecule, if we are having rate of reaction depending only on the substrate, not on the nucleophile, so if you increase the concentration of nucleophile 100 times, then also there will be no any change in the rate of reaction. So the reaction will be having the same rate. So it will be remaining the same. It remains same. Alright, so rate of reaction will be having no change by increasing the concentration of your nucleophile in SN1 reaction. Okay, so if it was SN2, then that will be having change, as the rate of reaction for the SN2 reaction depends on both the substrate as well as on the concentration of your nucleophiles. 𝘂10 is an intermediate of the reaction. 𝘂10 intermediate. So this 𝘂10 is a cyclic intermediate that is seen whenever we are having what? When we are having reaction of a carbonyl compound with a triphenyl phosphine, that is also known as 𝘿𝙬𝙎, gives you what? Alkene as the product. And the intermediate in this case we are having is the cyclic intermediate, that is known as what? 𝘂10, and this reaction is known as the Wittig reaction. This reaction is known as Wittig reaction. Wittig reaction. So the correct answer for this question will be A only. Reaction at chiral carbon through SN2 mechanism. So through SN2 mechanism we are having reaction on a chiral carbon. What kind of product do we are going to get? Retention of configuration, never possible, since we are having SN2 mechanism. So SN2 mechanisms always proceeds with Walden inversion. We are having always inverted product formation. The attack of nucleophile will always be from the opposite direction, from the opposite side of your substrate, in the substrate, and from the leaving group the attacking nucleophile must be opposite. So it means retention of configuration, no, that is never possible for the case of SN2. But yes, in the case of SN1 that is possible, because we are having in the case of SN1 carbocation intermediate formations. So it may be possibility for having the retention configuration products as well. Inversion of configuration, yes, that is the correct one. Why? Always in the case of SN2 we are having the inversion in configuration, and such kind of inversions are known as Walden inversions. Such inversions are known as Walden inversion, and yes, in the case of SN2 we always having the inverted product formation because of the attack of nucleophile from the leaving group is always opposite direction, from the opposite direction. So it means B option B is the correct one for this question. Okay, for the case of SN2. Now the next we are having this reaction is an example of what kind of reaction is this? We are having ketone, okay, and this ketone under the presence of what? Peroxy. All right, so this is a peroxy acid, and we are having insertion of an oxygen. So ketones becomes what? So this ketone becomes ester, and this reaction is known as what? Baeyer-Williger oxidation reaction. Under the presence of peroxy acid, any carbonyl, any ketone compound is getting converted into ester. So this reaction is Baeyer-Williger reaction, Baeyer-Williger oxidation reaction. Baeyer-Williger oxidation reaction, option D is the correct one. Option D is the correct one. Now the next, which of the following alkyl halide would undergo SN2 reaction most rapidly? So which of the following given compound will be having SN2 reaction most rapidly? All of these substrate molecules are having alkyl groups, same. It means the tendency of this leaving group will be deciding the rate of SN2 reaction. And either SN1, if we are talking about the SN1 as well as for the SN2, in both the cases, the ability of leaving group that will be deciding the rate of reaction for the SN1 and the SN2. Better the leaving group, faster will be rate of reaction. So here bromide, chloride, iodide and fluoride, due to longest bond length of carbon iodine, this iodide ion will be having the fastest removal, and that is why you can have this iodide ion, this as the fastest reaction because of the better leaving group. This iodide is your better leaving group for among all these given options. Better leaving group. Okay, so this C option, this will be your right answer. This is the right answer. This will be the correct answer. Cis and trans are called as, so the cis and trans are known as epimer, enantiomers, anomers and the diastereoisomers. Epimer is all about the stereoisomers that is having identical structures but only and only at a single chiral carbon. They are having configuration change, otherwise both the structures are identical to each other. So such kind of stereoisomers are known as the epimers. Like in the case of glucose and galactose, in the case of glucose and galactose, we are having C4 epimers, and in the case of glucose and mannose, these are your C2 epimers. What about enantiomers? They are non-superimposable mirror image relationships. They are having non-superimposable mirror image relationships. So they are enantiomers. Anomers, this is regarding the alpha and beta forms of the glucose. So whenever we are having conversion of a cyclic glucose into chain form and chain into again in the cyclic form, so this alpha beta configurations are seen, and this is known as what? They are known as the anomers of each other, and this conversion process is known as what? Mutarotation. Okay, mutarotation. And now the diastereoisomer. Since cis and trans are belonging to the category of GI, that is geometrical isomers, and all the geometrical isomers are diastereoisomers of each other, they are different images of each other. Never a cis form can be having the mirror image relationship with a trans form. It means all the geometrical isomers are belonging to the category of diastereoisomers. So the appropriate answer for this question, it will be diastereoisomers. They will be diastereoisomers of each other. So option D will be the correct one. Option D will be the right answer. Stereoisomers of cyclic carbohydrates. Cyclic carbohydrates, that is alpha and beta glucopyranose, okay, and the beta glucopyranose. So alpha form as well as the beta form, these are the cyclic carbohydrates, alpha and beta. These alpha beta are known as what? They are known as anomers of each other. They are called as the anomers. Okay, so B option is the correct one. Anomeric carbon is the first carbon. Sometimes it is asked like which carbon is the anomeric carbon. So the first carbon is itself the anomeric carbon. When a cholesterol is dehydrogenated, which of the following product is formed? So the cholesterol is getting dehydrogenated. So we are having cholesterol, that is cyclopentane perhydrophenanthrin. This is a general skeleton of a cholesterol molecule. Now this is your perhydrophenanthrin, and after the dehydrogenation from the perhydrophenanthrin ring, this perhydrophenanthrin ring becomes phenanthrin, and this kind of dehydrogenation results into the product that is known as a Diels product. That is known as the Diels product. That is called as the Diels product. So this is anthracene, no. Diels product, yes. That is your correct answer. That is your correct answer. That is the right answer. So this Diels product will be your right answer. Retin, now this belongs to what? They are dihydroterpenoids. They are having what? Dihydroterpenoid structure. So no, this is not about this. Diels product, that is conversion of a perhydrophenanthrin ring into where? Phenanthrin by hydrogenations. This kind of reaction will be known as giving you the product, that is the Diels product. Which of the following is the brand name of phenramine? So phenramine, which comes under the brand name of phenramine? Restaclin, fulgivin, avil and epitope. So phenramine, all right. So this avil is having what? This belongs to having phenramine. Avil is having this phenramine. So the brand name of phenramine, that is avil chlorphenramine maleate, that is CPM. Now this will be having what? This comes under the brand name of avil. So okay, so for the phenramine, we will be having the brand name of avil. That is the right answer. Which of the following is an electron deficient molecule? So here in this case, we are having 4 options, and which will be your electron deficient molecule? CH4, BH3, CCl4, Cn minus and the NH3. Now this NH3 and the Cn minus, they are actually having lone pair and negative charge respectively. So these are having electron rich centers, so they will be belonging to the category of nucleophiles. They are actually nucleophiles. What about CCl4? CCl4 is having complete octet. CH4 is also having the octet complete. But what about this BH3? This is having boron trihydrogens. Okay, so this is having a vacant p orbital. Now here in this case, we do not have complete octet formation of the boron. It means this BH3 or the BF3 or the BCl3, each of them, BCl3, each of them, as well as the AlCl3, the compounds of aluminium, these all will be having what? Electron deficiencies. It means the correct answer will be the BH3. Now this is your electrophile. This belongs to the category of electrophile. Why? Because they are having electron deficiencies, and the electron deficient compounds are having tendency to accept electron pairs. That is why they are known as the electrophiles. One of the following pairs represents a set of nucleophile. Which of one of the following pairs represents a set of nucleophiles? So which of them are given that belongs to have higher electron densities, or you can say they are electron rich centers? Cn minus, that is cyanide minus. Then we are having the NH3. Okay, so here also we are having electron rich negative charge, and this is also having lone pair. Okay, so AlCl3, like already I told you, this AlCl3 are electron deficient molecules, but Cl minus, they are electron rich. H plus electron deficient, H2O, oxygen will be having lone pairs. It means they also will be having what? They will be having electron rich. So this is your nucleophile, this is your electrophile, this is the nucleophile, this is your electrophile, this is nucleophile, this is nucleophile. So nucleophile, nucleophile. Okay, what we are asked, okay, a set of nucleophile, yes, that is the right answer. But this electrophile, Br plus positive electrophile, they are electron deficient. This is what? CCl2, dichlorocarbene. Now the dichlorocarbene is a reactive intermediate. Carbenes are electron deficient molecules. So these are electrophiles, these both are electrophiles. It's only A option that is having both the constituents thought to be having electron rich centers. It means they are nucleophilic in characters. The process of change of R configuration to S is known as. So if we are having R converting into S, now this is known as what? Inversion. This is inversion. So Jourdain inversion. Jourdain inversion. Direct answer. Jourdain inversion. Which of the following physical property differ for each pair of enantiomer? The only single physical property that is different for the enantiomers, that is ability to rotate plane polarized light. If one of the enantiomer is rotating the PPL into the clockwise direction to x degrees, the other will be rotating again to the x degree only, but in the opposite direction to the anti-clockwise. All right. So they are having direction of rotation of plane polarized light. Okay, that is different. That is the different. That is different. So B option is the correct one. Option B will be the right answer. Which of the following is our pericyclic reaction? So which of the given compounds is thought to be having the pericyclic kind of reaction? Cycloaddition, yes, they are cycloaddition reactions which are thought to be having like Diels-Alder reaction. This is this falls under the category of pericyclic reaction. So cycloaddition, yes, that is correct. Electrocyclic, yes, that is also correct. Sigmatropic, yes, this is also correct for the pericyclic reaction. And two famous reaction for the pericyclic is Cope rearrangement. Cope rearrangement, that is also known as what? 3,3 sigmatropic rearrangement. 3,3 sigmatropic rearrangement, and we are having the Claisen rearrangement. Now the Cope rearrangement and the Claisen rearrangement, both of them are categorized under where? Both of them are categorized under the sigmatropic rearrangement reactions. Now what about the electrocyclic? Electrocyclic, cycloaddition, these all actually are having the pericyclic reaction mechanism. So all of them falling under the category of pericyclic reaction. Pericyclic reaction. Now this is all about your pharmaceutical chemistry portion, and now we will be having the pharmaceutical analysis. Pharmaceutical analysis. Okay, so let's have the first question, that is fingerprint region for IER. Fingerprint region for the IER. We are having 1400 to 4000 centimeter inverse, 4000 to 8000 centimeter inverse, 400 to 1400 centimeter inverse, which is your fingerprint region for the IR. So if we are having for the fingerprint, it has to be 400 to 1400. Why? This 1400 to 4000, this is regarding the functional group. This is to differentiate the functional group. And this 4000 to 8000, this is for IR. Okay, so this is incorrect, this is incorrect. C option is for the fingerprint. Fingerprint IR will be for the C only. C, this will be your fingerprint IR. DSC belongs to the which kind of analytical method? So colorimetry, which kind of analytical method will be having the colorimetry? Spectroscopy, thermal, and hyphenated or chromatography. So thermal, they belongs to thermal. This colorimetry will be belonging to the category of thermals. Okay, principle of nephelometry and the turbidimetry is, so either we are talking about the nephelometry or the turbidimetry, absorption of light, reflection of light, scattering of light, or emission of light. So scattering of light, this is the correct principle for the nephelometry as well as for the turbidimetry. So scattering of light will be your right answer for this question. Scattering, they belongs to the principle for the scattering of light. The next question, which amongst the following is used as detector in spectrophotometer? So we are having what? Spectrophotometer. So what kind of detector do we are having for this spectrophotometer? 𝚋𝙀𝙎𝘾 cell, PMT. Next we are having what? Faraday cup, yeah, all of the above. So for the spectrophotometer, we will be having what? Photomultiplier tube, PMT, photomultiplier tube. So the detector that we will be using for the spectrophotometer will be for photomultiplier tube. All right. So this B option will be the right answer. Next one is metallic elements are detected by metallic elements. Metallic elements are detected by ESR, IR, atomic absorption spectroscopy, or the fluorescence. So metallic elements, they will be having the AAS, that is atomic absorption spectroscopy, as the right answer for this question. AAS. Luminescence, fluorescence, and the phosphorescence are the types of absorption spectroscopy, emission spectroscopy, both A and B, transmittance. So luminescence, fluorescence, and the phosphorescence, they all belongs to the category of what? Emission spectroscopy. In all of them we are having the emissions. So we will be having the emission spectroscopy. B option is the right one. Reverse phase chromatography. So the reverse phase chromatography, what kind of phases are there? In the case of reverse phase chromatography, stationary phase is non-polar, or the stationary phase is dipolar. Size exclusion, no, that is incorrect. Reverse phase, that is also incorrect. So the stationary phase that we use for the case of reverse phase chromatography, that is the non-polar one. That is non-polar. So A option is the correct one. And this is all about the chemistry portion. Now it's time for the non-pharma. Non-pharma portion as well. And now Aditi ma'am will be continuing this session, and she will be taking the non-pharma portion for this model paper. And this is all from my side for today. Thank you so much everyone. Now we'll be having the next session tomorrow with the same pharmaceutical chemistry portion in the tomorrow's class. All right, so I hope you all are present in that class as well. And for today, that's all from my side. Continue for the non-pharma portion with Aditi.
Welcome to all. How are you? Hope you are doing well. I'm going to start known pharma section with we are going to cover general knowledge, reasoning, aptitude and journaling English. So let's start. So question number 1 for the reasoning is in your screen, so you have to solve. Arrange the given words in alphabetical order and choose the one that comes first. So you have to choose that comes first in the fourth option. So fourth option is science, scrutiny, scripture and scramble. So what is the answer for this question? You have to arrange the word in alphabetical order and choose the one that comes first. Which one is come first from the four option? That is science, scrutiny, scripture, scramble. Anyone? Option A, science. Yes. Krish, very good. Option A is correct. Because if you see science, all four words come with S. So S, S, S. Here's science, S, S, S. Then you go with the second word C, 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 C. But if you see third letter, that is I, R. So I come first. So science is the correct order. So option number A is correct. Yes, science. Now move to the next question. That is question number 19. Select the number that can replace the question mark in the following series. So you have to place a number in place of question mark. So what is the number here? 87, 89, 92, 97, 104, 115. Now the question mark, you have to put the number, then 145. So how you complete that series? Let's see. If you add 2 in 87, that is 87 plus 2 is 89. When you add 2 in 2, that means you have to add 3. If you add 3, you will get 92. When you will add 5 in 92, you will get 97. Okay, am I right? Good afternoon, pharma profession. Okay, you have to add 2 in 87, you get 89. When you add 3 in 89, you get 92. When you add 5 in 92, you get 97. Now what you add? You have to add 7 in 97. You will get 104. So our series is going, that is 87, 89, 87, 89, 92, 97, 104. Then how to get 115? If you add 11, 104 plus 11 is equals to, you will get 115. Now what you have to add to get the number in the position of question mark? If you add 13, 115 plus 13 is equals to how much? 5 plus 3 is equals to 8 and 1 plus 1 is equals to 2 and 1. You will get 128. When you add 17 in 128, you get 145. So the correct option for the series is 128. Yes, yes, Krish, 813. Yes, prime number. Here we add all the prime numbers. Okay? Okay, option number B is correct. Yes. Now move to the next question, that is question number 120. So you have to complete that series also. So 4, 7, 12, 19, 28. So what's the next number? you add 3 in 4, you will get what? 7. When you add 5, when you add 5 in 7, you get 12. So here 4 plus 3 is equals to 7. 7 plus 5 is equals to 12. And 12 plus what number? 7, you get 19. And 19 plus what number? That is 9. You get 28. And when you add what number to 28? That is 11. You get 39. So 39 is the correct answer. Here we add odd numbers. Yes, option C is correct. Naveen, yes, pharma profession, very good. Option C is correct. That is 39. Now move to the next question, that is 121. Now what is the answer? Sorrow, death, happiness, what? Give instant answer for this question. 121. Sorrow, death, happiness, what? Yes, birth. Pharma, very good. Birth is the correct option. Option number D is correct. When someone is died, we feel sorrow. But when someone give birth, we all make celebrations. So birth, happiness, birth. Yes. Option D is correct. Now move to the next question. You have to complete that series XWC. You have to fill some alphabet or number, then TS20, then you have to also fill some alphabet or number here. Now what is the answer for this series? We have also given all the explanation in every after all the questions in the slides. Naveen, yes, option D is correct for 121. Now for 122, what is the correct answer? Option D is correct for this question, that is 23 𝘂𝙎𝑘𝙬𝑜ℎ. So here is 23 𝘂𝙎𝑘𝙬𝑜ℎ. So option D. So here's the explanation for the given puzzle. We can also say that here the difference is -1, -3, -1, -3, and you will get your answer. Now question number 123. In a certain code, rod is written as URDG. Now how to write SWAN, SWAN? Like if rod is written as URDG, then how to write SWAN? Now what is the answer for this question? Rod is written as, let's see, rod is written as URDG. Now you have to write SWAN. So what is the correct answer for this question? Yes, 123B. That is VZDQ. Yes, Pharma, yes. Option B. 𝑉𝑍𝑑𝑞. Yes, anyone? Yes, Naveen, option B is correct. You are right. Now, here is the explanation. Now move to the next question, that is 124. System is coded as cis-met and nearer as AENRER. Then we have to code it for fraction. So how is fraction written? As system is equals to, how to write, cis plus mat and nearer NEARER, that's AENR plus ER. Now you have to write fraction, FRACTION. So frac plus son. So what is the answer? 24A. That is square plus NOIT. That is, yes, your answer is correct. Option number A. So C come first. That is CARF. Then NINOIT. So the correct answer is A. Option number A. Yes. Now you can also join our NIPER free batch test series. Okay, you have to download our app from Play Store, so you can join us for a free test series. Now 125 question. In each of the following questions, 4 words have been given out of which 3 are alike in some manner, while the 4th one is different. Choose out the odd one. You have to choose out the odd one from the words that is given here. So first is bajra, second is mustard, third is rice, and fourth is wheat. Yes, option B is correct, because bajra, rice, wheat are in a same category. Mustards, we have oil. So mustard is correct answer. Option B is correct. Yes, farmer profession. So mustard, oil seed, while bajra, rice and wheats are grains. Now 126. You have to find the relation between two given groups of alphabetical letters interrelated to each other and choose the pair consisting of similar related letters groups. So light, sun, heat, what? Heat, what? Electricity, moon, fire, star. What is the correct answer? (126) C. Yes, fire. Option C is correct. So fire produces heat and sun is a source of light. That's why light, sun and heat, fire. Now move to the next question. That is question number 127. You have to arrange in a in ascending order. So first is cook, second chew, third digest, fourth bite and fifth swallow. So what is the correct ascending order for all the given words? Now arrange all these words in ascending orders. Now which word come first? 127C, option C. Like first cook, then bite, then chew, then swallow, then digest. So option number C is correct. First we cook the food, then we take bite, then we chew the food, then we swallow, then digestion. So option number C is correct. Yes. Now move to the next question, that is question number 128. So here is some Venn diagrams. So you have to choose the correct one for carrot, food, vegetable. So here is some Venn diagram. So you have to choose the correct one, that is carrot, food, vegetable. So or are foods, that is food, then vegetable, then carrot. So option number A is correct. Yes. Farmer profession 128. Option A is correct. Yes, your answer is correct. Naveen, your answer is also correct. Now move to the next question, that is question number 129. Akash ranks 7th from the top and 27th from the bottom in a class. How many students are there in the class? So you have to find that how many students are in the class if Akash ranks 7th from the top and 26th from the bottom. So what is the answer for this question? Akash ranks 7th from the top and 26th from the bottom. So you have to find the how many students are there in a class. (129B), Naveen, option number B, that is 32. Let's see, as you know, in this type of question you can 7 multiply 26 minus 1, that is 32. So option number B is correct. As from the top Akash is in 7th position and from the bottom it is in 26th position. Okay, 7 plus 26. So Akash is common in from, if we see from the top and from the bottom. So 7 plus 26 minus 1, that is 32. So option number B is correct. Farmer profession, check your answer. Answer is 32. Option B, Naveen. Yes. Now move to the next question. My father's only brother's wife, only daughter's parental uncle is my mother's. Now you have to find the relation. My father's only brother's wife, only daughter's parental uncle is my mother. What? You have to find the relation with mother. Now, quick, give the answer. Now here's the complete structure. My father's only brother is my uncle. Okay, his wife is my aunt. Now their only daughter is my cousin. So her parental uncle is my father. So my mother's husband is my father. So husband is the correct option. Option B. Yes, husband. Naveen, very good. Now move to the next question, that is 131. Akshat walked 30 meters towards east, took a right turn and walked 40 meters. Then he took a left turn and walked 30 meters. In which direction is he now from the starting point? So you have to find the Akshat position from the starting point. Okay, as we know, here's direction north, east, west, south. For instance, let Akshat is here. Now first he moves towards, Akshat walked 30 meters towards east. So he moves 30 meters towards east. Okay, so 30 meter. Now he take right turn and walk 40 meters. Now the right of Akshat is in that direction, that is in south direction, that is 40 meter. Then he took left turn and walked 30 meters. Then he again take left turn. It means he moved towards east 30 meter. Now in which position he is here? We can see that is it is in east, southeast. So the correct answer is southeast. Option number C is correct. Yes. Naveen, very good. Option C is correct. Yes. Southeast. Now move to the next question. That is question number 132. So disease is relatable to health. Now freedom is. So we can say that opposite of health is disease and opposite of freedom is what? That slavery. So option number A is correct for question number 132. So question number 132's answer is option number A, that is slavery. 132 option A, yes, slavery. Pharma profession, very good. Now move to the next question, that is, yes Naveen, option number A is correct. Now move to the next question, that is 133. If 3rd December 1990 is Sunday, what day is 3rd January 1991? Now, what is the answer for this question? If 3rd December 1990 is Sunday, what day is 3rd January 1991? Question number 133. As you can see that 3rd December to 31st December, there are 28 days, okay, from 3rd December to 31st December, and from 31st December to 3 January, 31st December to 3rd January, how many days? There are 3 days, so total days how many? 28 plus 3, that is 31 days. So you can divide 31 by 7, okay? So you will get 4 weeks plus 3 days. Option A. No. Option B is correct. Naveen. That is 4 weeks plus 3 days. Now we have to move 3 days. Okay, we have to move 3 days forward from Sunday. 3 days forward from Sunday. That means Wednesday. So option number B is correct. We have to move 3 days forwards from Sunday. So Wednesday, Sunday, Monday, Tuesday, Wednesday. So Wednesday is the correct answer. Option B. Now question number 134. Parrot, cage, man. Like parrot live in cage, now man live in. What is the answer? Yes, Naveen. Option number B is correct for 133 question. Now for 134. Option number C. No. Option A, yes. Option A is correct, Naveen. Yes. Option A, that is home. Home is the correct answer for 134. Now move to the next question. You have to complete that series 11, 13, 17, 19, 23, 24. You have to complete that series. Here you can add first plus 2, then plus 4. 11 plus 2 you will get 13, 13 plus 4 you will get 17, 17 plus 2 you will get what? 19. When you add 4 in 19 you get how much? 23. That is plus 2 plus 4 plus 2 plus 4 plus 2 plus 4. So the answer is option number C. Yes, that is 29. Option number C is correct. 29. Yes, Naveen. Answer 29 is correct. Pharma profession, what is your answer? Now move to the next question, that is question number 136. You have to complete that order also. WEB, TGD, QHG. Now next is, yes, 29. Yes, pharma profession. Now what is the answer for this question? Question number 139. Question number 136. Naveen and pharma profession, what is your answer? B, yes. NIK is the correct answer. Yes. Naveen, answer is NIK, that is option number B. Check carefully your answer, you will get NIK. Yes, NIK. Here is the explanation for this question. Now, you have to arrange these words like crop, root, stem, seed, flowers. Okay, you have to arrange in a sequence. So, what is the correct sequence for this question? You have to give the correct sequence for this question. So first having seeds, then root, then stem, then flower, then we can say crop, that is fasal. So what is the correct sequence for this order? One 137B, yes, option number B is correct. 42351. 42351, yes. Option B is correct, yes. Pharma and Naveen. SK, very good. Option number B is correct. Now move to the next question, that is 128. Now you have to complete that letter series. You have to complete that letter series. Now what is the answer? Pharma, Naveen and SK. Which of the following set of letters complete the letter series when sequentially placed at the gap? So here is the explanation that B is in first position, fourth position, sixth position, 10th, 11th and 16th. So the correct answer is B, B, C, B, B. Option number A is correct for question number 138. Now question number 139. If cat is coded as PATC, joy is coded as POYJ, then you have to code for wing, WING. So the correct answer for WING is cat is coded as PATC and joy is coded as POYJ, then you have to code for wing, WING. So the correct answer is, as we know, it starts from P. So P is there. Option B, 137B Now for 139, what is the answer? SK Pharma Naveen. For 139, what is the correct answer? As cat is coded as PATC. Joy is coded as POYJ. POYJ. Now wing, WING, is coded what? P. Option B, PINGW. Yes, PINGW. Yes, SK and Pharma. Very good. Option number B is correct. So PINGW is correct. Now move to the next question, that is question number 140. By looking at a mirror, the time in a clock appears to be 30 minutes past 9. The actual time in the clock we have to find. We have to find the actual time in the clock if by looking at a mirror, the time in a clock appears to be 30 minutes past 9. Okay, so PINGW, yes, Farmer. Now for question number 120, what is the answer? So as we know one formula, that 11, 60 or 12 is equals to actual time plus mirror time. Is equals to actual time plus mirror time. So here is given mirror time, that is 9:30. Mirror time is 9:30, that is 9:30. We have to find actual time. So the actual time is what? So the actual time is what? Option A, that is 30 minutes past 2. Yes, your answer is correct. That is 2 hours 30 minutes. It means 30 minutes past 2. 2 hours 30 minutes, that is 30 minutes past 2. So option number A is correct. Now move to the next question, that is question number 141. You have to complete the given series, that is 39, 52, 78, 117 and 169. So now what's the next number in that series? We have to find. So we have to find the next number in the given series. If we add 13 in 39, we get 52. And if we add that both number, that is 26, you will get 78. If you add 39 in 78, you get 117, and 52, you get 169, and when you add what number, that is 65, so you get how much, what number, that is 234. So the correct answer is 234. Option number C is correct for question number 141. Pharma, SK, Naveen, what is your answer for this question? 141, option C, yes, 234 is the correct answer. Now move to the next question, that is question number 142. So select the correct combination of mathematical sign to replace star sign to be balance the given equation. So you have to replace the star sign by the given signs, that is plus, minus, divide. Okay, so you have to put that sign in the given equation, that you get the balanced equation. Okay, so 8 star, 4 star, 2 star, 6. Okay, you have to add some sign here, some mathematical sign here to get the balanced equation. Okay, now what is the answer for this question? Not that difficult, mind mode. If you try, you will get your answer. 8 plus 4, that is, then divide 2 multiply 6, you will get 20. So 8 plus board mass here you use. So 2 to the 4 multiply 6. So 8 plus 12 is equals to 20. So you will get plus divide multiply, plus divide multiply, plus divide multiply. So option number B is correct. Yes, pharma profession mind mode D, not D. Option B is correct. Plus divide multiply. Next, question number 143. So in this question, here is some equation and having some letters here like N, L, P, M. So you have to replace these letters by mathematical sign that is given in the equation, that L means plus, M means minus, N means multiply, and P means divide. So you have to solve this equation and get your answer. So try to solve this equation and let me know the answer of the given question. So the question is 14N, 10L, 42P, 2M8 is equals to that what number is equals to what number. So N is replaced by multiply. So 14 multiply 10. Now L is replaced by addition sign, that is plus. Now 42. Now P is replaced by divide, then 2. Now M is replaced by minus, now 8. So now you can solve this equation, you will get your answer. 14 multiply 10 plus 42 divide 2 minus 8. So the answer is for question number 43, option number A. Option number A, that is 153. Yes, your answer is correct, pharma profession. That is option number A is correct. 153 is the correct answer. Now move to the next question, that is question number 144. B is the husband of P, Q is the only grandson of E, who is wife of D and mother-in-law of P. How is B related to D? Now what is the answer for this question? Question number 143. So the correct answer for this question is option number D, that is son. So B is related to in the form of son. E is wife of D, that is D and E are husband wife. E is mother-in-law of P, that is P is married to E's child. Now B is husband of P and B is that child of D and E. So the correct answer is son, son of D and E. Now question number 145. Shobha is the niece of Ashish. Ashish's mother is Priya. Kamla is Priya's mother. Kamla's husband is Hari. Krishna is the mother-in-law of Hari. Now H is Shobha related to Hari. Like how is Shobha related to Hari? We have to find how is. That is how is Shobha related to Hari. So the answer is great grandson, great granddaughter. Now question number 147. A, B, C, D are playing cards. Okay. A and B are partners. D faces towards north. That means north, south, east, west. So D is faces towards north. That means D is here. If A faces towards west, that is A is here, and A faces towards west, then who faces towards south? Okay, as we know that A and B are the partners, so they are sitting in opposite. So A is here and B is here. B is facing east, so C is facing south. So option number B is correct for question number 146. As A is facing west, B is facing A, that means B is facing east. Now D is facing north, that is given in the question. So opposite of D is C, and C is facing what? South. So question number 126 is completed and the answer is option number C. Now some questions for general knowledge GK. So the question number 1 is there. So the answer for question number is what? So you have to give the answer that how many medals did India win in Asian Wrestling Championship 2026. Now give the answers instantly, because it's a portion for general knowledge and you have to answer it instantly. So the question number 1 is how many total medals did India win in the Asian Wrestling Championship 2026? Now the answer is Farmer Profession, Mind Mode, Naveen, SK. So the correct answer is option number D, that is 17 medals. From 17 medals, 2 are gold, 6 are silver and 7 are bronze. So total 17 medals India win in Asian Wrestling Championships 2026. No, option number D is correct. Farmer Profession. Option number D is correct, that is 17 medals total. Okay. Now move to the next question. Here is the complete explanation that 2 gold medals, 6 silver medals and 9 bronze medals, total 17 medals. Okay, now question number 148, you have to give the answer. Which country is the host of ICC Women Cricket T20 World Cup 2026? You have to give the answer that which country is the host of ICC Women's Cricket T20 World Cup 2026? I think you should everyone know the answer of this question. Which country hosts ICC Women's Cricket T20 World Cup 2026? Anyone? Farmer Profession, Mind Mode. What is the answer for this question? So the answer is England. England is the country which hosts T20 World Cup 2026. Okay. Now move to the next question. Next question is, what was the India's rank in World Happiness Report 2026? No mind mode. England. England is the country which hosts ICC. You have to give the answer. What India's rank in World's Happiness Report 2026? So the rank is 116. That is 116. India secured 116 position out of 147 countries. 147 countries are participated, so India's rank is 116th. And last year, if we talk about 2025, the position of India is 118, that is 118. So India improved 2 ranks. Now in 2026, India's rank is 116. Now question number 150. Where was the 23rd Bio-Asia 2026 International Summit held? Where was the 23rd Bio-Asia 2026 International Summit held? 4 options you have: Bangalore, Hyderabad, Pune, Jaipur. So the correct answer is Hyderabad. Hyderabad was the city where 23rd Bio-Asia 2026 International Summit held. Okay? Yes, Hyderabad. Niharika. Hyderabad. Now move to the next question. जोड़ जो टूटेगा नहीं. जोड़ जो टूटेगा नहीं tagline is related with brand. Which brand? Which brand tagline is जोड़ जो टूटेगा नहीं? You have 4 options, that is MCL, Fevikwik, Fevicol, Ambuja Cement. So the correct answer is जोड़ जो टूटेगा नहीं tagline is related from which brand? That is MCL, Fevikwik, Fevicol या फिर Ambuja Cement. So the correct answer is Fevicol. Yes, mind mode, very good. Fevicol is the correct answer. That is option number C. Now move to the next question. Which social media platform launched SMBS Sathi Utsav to support small business? That is Facebook, WhatsApp, Twitter, Co. So the right option is, which social media platform launched SMB Sathi Utsav to support small business? To support small business, that is WhatsApp. Option number B is correct. Yes, Niharika, option number B is correct. That is WhatsApp. Now move to the next question, that is question number 153. What is the name of new model school proposed by Union Education Minister? So you have to give the answer that what is the new model school proposed by Union Education Minister. So you have 4 options, that is PM model schools, PM Sri schools, Atmanirbhar schools or Bharat Gaurav schools. So the answer is PM Sri School. Yes, Niharika, option number B is correct. 153. Question number 153 answer is option number B. That is PM Sri Schools. Now move to the next question. That is 154. Who started the prestigious Bharat Bhushan Award? Who started? ISA Foundation, Sangeet Natak Academy, Ministry of Culture, Buddhist organization. So, which organization start prestigious Bharat Bhushan Award? The correct option is option C. No. Option A is correct. That is ISA Foundation, and ISA Foundation is related to which Sadhguru? Yes, the organization was founded by Sadhguru. So the correct answer is ISA Foundation. Now move to the next question. Which state government has launched the One Family, One Entrepreneur scheme to promote entrepreneurship in every household? So we have to give the answer. Which state launched One Family, One Entrepreneur to promote scheme? Ministry of Culture, no. In this question you have to find the state, that is Odisha, Maharashtra, Andhra Pradesh, Karnataka. Andhra Pradesh, yes. Option number C is correct, Andhra Pradesh. Now move to the next question, that is question number 156. Which state government has launched the Rajiv Gandhi 𝘂𝙂𝙎𝙬𝙬 Yojana? Which state have launched Rajiv Gandhi 𝘂𝙂𝙎𝙬𝙬 Yojana? The answer is Himachal Pradesh. Himachal Pradesh is that state government has launched Rajiv Gandhi 𝘂𝙂𝙎𝙬𝙬 Yojana. Now question number 157. Pradhan Mantri Sukriti Matritva Abhiyan PMSMA was launched by which ministry? So which ministry launched Pradhan Mantri Surakshit Matritva Abhiyan? प्रधानमंत्री सुरक्षित मातृत्व So the answer is Health, Ministry of Health and Family Welfare. Option number D is correct. Option number D. Niharika, option number D is correct. Now question number 158. �々𝙁 is manufactured by which company? Which company manufactured �々𝙁? GlaxoSmithKline, Dabur, Dvisa Herbal Care or Abbott India Limited? So the correct answer is which manufacturer company? Yes, option number C, that is Dvisa Herbal Care. Now question number 159. Which of the following software is used for molecular dynamics except? We have to find that which following software is used for molecular dynamics except. That is MD2. That is MD2. So option number C is correct. Now move to the next question, that is question number 160. Sigma Stat software is used for? Sigma Stat. So we can see that stat is here. So stat is relatable to statistics. So statistical calculation. So option number B is correct for question number 160. Yes, Niharika, MD2 for question number 159. Now move to the next question, that is 161. The remission of duties and taxes on exported products scheme is administered by which department? So the answer is Department of Revenue. That is option number B is correct for that question. That is question number 161. Now for aptitude, okay, now you have to solve some questions. Okay, so the question number 1 is in your screen, so you have to find the answer for this question. So two numbers are such that 0.3 times of first is same as 0.85 times the second number. So what is the ratio between the first and the second number? So the question is there is some number that is 0.3 times of that number is equals to 0.85 times of another number. So you have to find the ratio between the numbers. Okay. Now what is the answer? So you have to consider two numbers. You can consider A and B. Okay, A is first number and B is second number. So we can say that 0.3 times of A is equals to 0.85 times of B. So we can say that it means 0.3 times of A is equals to 0.85 times of B according to the question. We have only write that condition which is given in the given question. Okay, so we have to find the ratio of which, that is A ratio B. We have to find A ratio B, that is A by B. With the help of A by B we can easily find A ratio B. Okay, so 0.85 divided by 0.3, we can write this. Okay, if there is a number in multiplier, when it go in another side, that is maybe LHS or RHS, multiply, change into divide. So A by B is equals to 0.85 upon 0.3. So 0.85 upon, we can write this, if we remove decimal from denominator, we can multiply 10 in the numerator. Similarly, when we remove decimal from the numerator, we have to multiply by 100 in the denominator. So 10, 0 cancel by 0, it means 85 upon 30. So we can say that 17 by 6, that is A ratio B is equals to 17 ratio 6. So the correct answer is 17 ratio 6. So option number B is correct. Understood or not? Now move to the next question, that is question number 163. So what is the answer for question number 163? The question is, a number x is short of y by 20%, then what percent is y in excess of? Anyone? Pharma profession, understood? So the next question is, a number x is short of y by 20%, then what percent is y in excess of? Option A, that is 20%. Niharika. We can say that x is 20%, according to the question, we can say that x is 20% less than y. Okay, according to question, x is 20% less than y. Okay, so x is equals to 80% of y. We can say that x is 80% of y. It means x is equals to 0.8 y. So the value of x is 0.8 y, and y is equals to x upon 0.8, that is equals to 1.25 of x. So the excess percentage is 1.25 minus, that is 1 multiplied by 100, that is 25%. That is option number D is correct. Option number D is correct for that question 163. Now move to the next question, that is question number 164. So in question number 164 there is a sequence of number given. So which is the third number to the left of the number which is exactly in the middle of the following sequence. So in the question we have to find that in the sequence there is some middle number and we have to find the third number from the left of that middle number. Okay, so we can say that the given sequence, in the given sequence, the number which is in middle, so we have to find the third number which is left to the middle of that number. Okay, so if we count all these numbers, there are total how much numbers? There are total 27 numbers are here. That is, we can say that 27 digits are there. When you count all, they are all 27 digits. Okay. And you have to find the middle of the number. That means 27 plus 1 upon 2, that is 28 upon 2, that is 19. 2 ones are 2, 2 4s are, that is 14. So that is 14. That means 14th digit is the middle number. That is 14th digit is the middle number. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 9 is the middle number. 9 is the middle number. So you have to find what? Third number to the left of that number, that is 9. So left of 9 is 1, 2, 3, that is 4. So the correct answer is 4. That is option number B is correct. Yes, option B, 4 Niharika, option number B, farmer profession, yes. Option number B is correct. Very good. Now move to the next question, that is 165. Question number 165 is, a class of boys stands in a single line. One boy is 19th in order from both the ends. How many boys are there in the class? So we have to find that how many boys are in that class. So total number of boys is how much? So there is a boy stand in a line. One boy is 19. So there is a boy that is in 19th position from both the ends. So there are some boys here and there are some boys here, and we are talking about that boy that is in 19th position. So how many boys are there in the class? So we have to find that how many boys are there in the class. So 18 boys before and 18 boys after him. 18 boys before him and 18 boys after him. So 18 plus 18 and 1 is also the boy, that is 18 plus 18 plus 1. So total how many boys there? So there are 37, that is 37. Option number B, yes. Farmer profession, very good. Option number B is correct. 37. Now move to the next question, that is question number 164. Study the information given below carefully and answer the question that follow. So A, B, C, D, E, F, G, H, I, J, H, I are 9 houses. C is 2 km east of B and A is 1 km north of B and H is 2 km south of A. And G is 1 km west of H, while D is 3 km east of G and F is 2 km north of G. Now I is situated just in middle of B and C, while E is just in middle of H and D. So we have to find the distance between E and I. We have to find the distance between E and I. So here's an explanation that if C is 2 km from east of B, that is C is 2, 0. In this we can take x or y axis. Okay, so east, west, north, south. X-axis x comma 0 minus x comma 0, 0 comma y and 0 comma minus y. Okay, according to the axis. So with the help of this axis we can put these numbers here. So C is 2 kilometer east of B. Okay, so east of B, this is in which position? X position. That's why 2 comma 0. So 160. Okay, 166 farmer profession, option number A, that is, yes, 1 kilometer is the correct answer. Very good. Option number A is correct. Yes, bravo, very good. So with the help of this we explain all this in that and we get 1. So 1 kilometer is the correct answer. So E and distance between E and I is 1 kilometer. Now move to the next question. So you have to find the average of first 20 multiples of 9. So we have to find the average of first 20 multiples of 9. Like how to do this question? As you know, average is equals to first term plus last term divided by 2. Average is equals to first term plus last term divided by 2. Okay, and if you see the number first 2, 1, 2 and up to 20 and all are multiples of kya? What? 9. So first we can say that first is 1 multiply 9 and second, that is last, not second, that is last, is equals to 20 multiply 9. So 9 and that is 180. So 180 plus 9 divided by 2. So you will get your answer. So what is the answer? Farmer profession, Niharika, what is the answer of that question? When you solve this 180 plus 9, because we have to find the average of first 20 multiples of 9. They particularly said that multiples of 9. So the first number is 1 and the last number is 20. So we have to find a multiple of 9. So 1 multiply 9 for the first number and for the last number 20 multiply 9. So as we know, average is equals to first number plus first term plus last term divided by 2. So in this question we have done like that. So 9 plus 180 divided by 2. So 94.5. Yes, Niharika, 94.5 is the correct answer for that question. Here is the complete explanation for the given question. Now move to the next question, that is question number 168. If the average of 5 numbers is 10, the average of 5 number is given, the number which should be added to make the average 12. So we have to add that number, the average becomes 12. So in the question is the average of 5 number is 10. Okay, average of 5 number is given, that is 10. Now you have to add what number in that the average become what? 12. Okay, so first we find the total. Okay, so 5 multiply 10 is equals to 50, that is total sum. Okay, so you have to add some number to 50. Now the numbers is 6, that is 5, the number that already average given, but we have to one more number, okay, to becomes average 12. So when we add one more number, the total numbers becomes, that is 6. 5 plus 1 6, so we divided by 6. Okay, is equals to what? 12, because we have to become the average 12. Okay, now 50 plus x is equals to 12 multiply 60. We can simplify and get the number. When we add that number to 50, the average becomes 12. So the answer is 22, option number C. Yes, option number C, mind mode, very good. Option number C is correct. That is 50 plus x is equals to 72, then x is equals to 22. So option number C is correct. Very good, mind mode. Option 22 is your correct answer. So if you add 22, you will get the average 12. Now question number 169. The LCM and HCF of two numbers are 84 and 21 respectively. If the ratio of two numbers is 1:4, then the larger among two numbers, we have to find which number is larger. Okay, as we know, the ratio of two numbers, that is A ratio B, that is 1:4, so we can say that x and 4x. Okay, and as we know, LCM into HCF is equals to product of two number, so we can say that x multiply 4x is equals to what? 84 multiply 21. So 4x square is equals to 84 multiply 21, that is 21. So x is equals to what? 21. So x is equals to what? 21. So the numbers are x is 21 and 4x, that is 4 multiply 21, that is 4 1s are 4 2s are 8, that is 84. So the numbers are 21 and 84, but we have to find the larger. So the larger number is 84, that is option number D is correct for question number 169. Understood? The question is, the LCM and HCF of two number is given, that is 84 and 21, and the ratio of the two number is also given. So we have to find the larger number. So to find the larger number, first we have to find some value for x. So the ratio is A ratio B, that is 1:4. So we can say that x and 4x, the two numbers are x and 4x, and we know the formula that the product of LCM is equals to product of two number. Okay, product of LCM is equals to product of two numbers. So with the help of this formula, we can easily find the value of x, and by finding the value x, we can easily find that the numbers are 21 and 84. So 84 is the answer for question number 169. Okay. Now move to the next question, that is 170. So in this question, there is some expression given. So you have to replace some signs. Okay. So you have to replace, that is, you have to replace multiply by divide, minus by multiply, divide by plus, and plus by minus. And you have to solve this expression. Now solve this question and let me know the answer. So minus change into what? Multiply. So 4 multiply 15. Now divide is change into plus. So 15 plus 12. Bracket close. Now multiply, replace by divide. 8. Now plus. Plus means minus, that is 9. Now so the answer is -1, 2, 0 or 1. Anyone? What is the answer? 170C. 170, option number C, yes, 0. 0 is the answer. You get 60 plus 12 divided by 8 minus 9, that is 72 divided by 8 minus 9, that is 9 minus 9, you will get 0. So option number C is correct. Pharma profession, yes, 0. Added Gaurav, 0, yes. Now move to the next question, that is question number 171. So you have to solve that problem, that is 48% of 420 plus 32% of 470 is equals to 11% of what number? You have to find that number. Like if 48% of 420, that is 48 upon 100 multiply 420 plus 32 upon 100 multiply 470 is equals to 11 upon 100 multiply x, because you have to find that number. Okay, so cancel 100 by 100. Okay, so when you multiply 48 and 420, you will get 20160, and when you multiply 32 by 470, okay, 470, you will get 15040 is equals to 11x. So what is the value of x? Anyone? So what that number? The value of x is, you get 35200 divided by 11. So the value of x is 3200. So option number A is correct for question number 171. 3200. Three two zero zero is the correct answer for 171 question. Now move to the next question. Next question, next part, that is journal English. You have to give the answer instantly. Okay. This model paper is for your practice. This marathon is for your practice. So you have to give the answer instantly. Okay. Yes, Niharika. 3200 is the correct answer. Now we are going to start journal English. Okay. Okay. Now the question 1 is to keep one's head. It's an idiom. So you have to answer the given question. So the meaning of to keep one's head means to remain calm in an some emergency situation. So the correct answer for this, to keep one's head, it means to keep calm. So option number B is correct for, yes, to keep calm. Yes, Niharika, very good. Option B, that is to keep calm. Now move to the next question, that is question number 173. You have to give the antonyms of sympathy. So sympathy is the feeling of care for someone. Okay, like if you are caring for someone, for sorrow, like so you have to give the antonym of sympathy. So the option is enmity, cruelty, adherence, apathy. So the answer is apathy. Very good, Niharika. Option number D is correct. So sympathy means understanding and sharing the feeling of others. Apathy means lack of emotions. Like when we can say na that you have lack of emotions, you do not understand the situation, like, so that means he's so apathy. Okay. Enmity means deep hatred or hostility. Cruelty causing pain or showing no kindness. Okay, so the correct answer of sympathy and the antonym is apathy. Now move to the next question. You have to give the answer like antonym of erudite. Erudite. Antonym of erudite. Professional. The meaning of erudite is showing great knowledge. Okay, showing great knowledge. And if we see in the given option, ignorant is the antonym of erudite, because in if we go for professional or some other words, that notes match the antonym of erudity. So erudity means having great knowledge, learning or education. Ignorant means lacking knowledge, that someone have a lack of knowledge and awareness or education. Okay. Now move to the next question. You have to give the answer like synonym of accredited. Synonym of accredited. Synonym of acquitted. entrusted, convicted, burdened, freed. Acquitted is not guilty. The meaning of acquitted is not guilty. The meaning of acquitted is not guilty. Yes, Niharika. Freed is the synonym of acquitted. So acquitted means to be declared not guilty or cleared of a charge in a legal cases. When we are talking about legal cases, we use that word acquitted. Freed means released or set free, which matches the meaning of acquitted. Okay. If we go for the word like entrusted, given responsibility to someone unrelated. Okay. Convicted, declared guilty or a crime, that also opposite a meaning. Okay. If we talking about burden, means loaded with responsibilities or trouble, so it is also unrelated. Now move to the next question, that is 176. You have to give the synonym of audacious. Audacious. You have to give the synonym of audacious. Dumb, daring, attractive, dangerous. Synonym of audacious. That is daring. If we talking about the meaning of audacious, is like someone who is freely daring. Okay, someone who is freely daring, so the synonym is daring. So option number B is correct. Yes, daring, Niharika. Daring is, that is bold and brave. Okay. Now antonym of spread. You have to give the antonym of spread. Spread is spread. The meaning of a spread is to expand, grow. So you have to give the antonym. Contract. Yes, Niharika. Option number D is correct. Contract. Now you have to complete the sentence from the given combination of the sentence. So you have to complete, you have to make one sentence. Okay. The pieces is given, that is PQRS. So the correct option you have to give. P is therefore you must listen carefully. Q is what the speaker has said. And R is in order to understand. And S will be made just once. So the right form to complete this sentence is, that is will be made just once. We can go for S, that will be made just once. Therefore you must listen carefully in order to understand what the speaker has said. Okay, we can say that will be made just once, therefore you must listen carefully in order to understand what the speaker has said. It means SPRQ. SPRQ. So option number C is correct for question number 178. Option number C. First, will be made just once. Second, therefore you must listen carefully in order to understand what the speaker has said. So, like this. Now move to the question, that is 179. You have to find the synonym of altruistic. Altruistic, that showing a selfless concern for well-being of other without care for one's own interest. So we can say that selfish, selfless, or maybe selfish. So the synonym of altruist is humanist. That is humanist. So option number A is correct. So greedy is opposite meaning, selfish is opposite meaning. We can say that selfless. Okay. So considerate, related, but not exactly selfless or illustrious. So the correct option is humanist. Yes, humanist, Niharika. Now move to the next question, that is 180. In question given below, out of 4 alternatives, choose one which can be suited for the given word. Okay. So a person who knows many foreign languages. A person who knows many foreign languages. So what we called him? Okay. The person who knows many languages, foreign languages. So what we called him? Linguist, grammarian, polyglot, bilingual. So bilingual is those person, a man who know only 2 language. Bi means 2. So those person who only know 2 languages. So this is out of syllabus. Okay. Now linguist, having knowledge of languages. Linguist is knowledge of language. Knowledge of language. Having someone different knowledge of languages. Okay. And grammarian who know English grammar very well. Okay. Now the option C is correct, that is polyglot. A person who knows many foreign languages said to be polyglot. So option number C is correct. Yes. Farmer profession, yes. Option C is correct. Niharika, very good. Now move to the next question, that is question number 181. It was a facetious remark which totally failed to make any impression. To make any impression. Facetious is like a joking. Okay. We can directly see that option B is going for the question 181, or maybe facetious. So joking is the correct answer. That is option number B. So irrelevant, unrelated, joking, humorous. Okay. Now 182. As they whispered, I felt awkward in their company. Okay, so what is the answer for this question? As they whispered, I felt awkward in their company. So the options are inconvenient, clumsy, proud, or embarrassed. So we can say that awkward, embarrassed. When we feel awkward, we feel embarrassed. So option number D is going for this question. Yes, and it got option number D is correct. Embarrassed. Clumsy, not graceful. Proud, feeling success. Inconvenient, causing trouble. So impressed when we feel awkward or uncomfortable. Now move to the next question, that is 183. In the given question below, out of 4 alternatives, choose the one which can be substituted for the given word, that is murder of a king. Murder of a king said to be what? Infanticide, matricide, genocide, regicide. So the correct answer is what? The question is, you have to replace murder of a king by the given 4 words. So which word is suitable for that given words? That given murder of a king. Matricide. That is regicide. Infanticide, as we know, that killing of an infant. Okay, as we know. Matricide is killing of mother. Okay, not killing murder of king. Okay, genocide is killing of a large group or race. So the correct answer is regicide, that is murder of a king. So option number D is correct, that is regicide. Niharika, regicide is the correct answer, not matricide. Matricide is the killing of a mother, said to be matricide. Now move to the next question. Synonym of deflect. Synonym of deflect, and you have four options, that is frustrate, cheat, pervert, depress. So deflect is to change the direction of something. Okay, so change the direction of something is said to be deflect. Now you have to give the synonym of deflect. So the correct option is pervert. Like deflect means turn aside or divert from their original path or purpose. Okay, and pervert also means to turn something away from its true or proper course. Okay, we can say that deflect, pervert. Frustrated means to prevent success or stop plan, that is unrelatable. And if we're talking about cheat, to act dishonestly, that is also unrelatable. And if we talk about depress, to make sad or lower in level, this is also unrelatable. So the option number D is correct, that is pervert. The synonym of deflect is pervert. Okay, let's move to the next. Now, synonym of exorbitant. Synonym of exorbitant. Exorbitant is a adjective. Used to describe something, usually a price, fees. Okay, so exorbitant is an adjective to describe like a fees or price or a demand. Very large, excessive, yes, excessive. Option C is correct, excessive. Option C is correct, excessive. Niharika, very good. Yes, Rekha. Exorbitant means something that is far too high or beyond normal limits. Okay, especially in price or demand. Excessive means more than what is reasonable or necessary, and that's why the synonym of exorbitant is excessive. That is too much, over the limit. Okay, that is too much, over the limit. Now move to the next question, that is 186. Synonym of diligent. So diligent is having or showing care in one's duties or industries. Okay, synonym of diligent. So diligent is a showing some cares in one's work. Okay, like in industries, in duties. So we have four options, like intelligent, energetic, modest, industrious. So the correct answer is option D, farmer profession. Yes, industrious. Option D is correct. for 186 question. Okay. Now move to the next question, that is 187. You have to choose the odd pair of the given words. That is, first if we talking about stallion, colt, horse, mare, dog, bitch, drake, duck. So you have to find which word is odd from the given words. You have 4 options: stallion, colt, horse, mare, dog, bitch, drake, duck. Question number 187, you have to choose the odd one. Okay, so for yes, stallion, colt. Very good, Niharika. The correct option is stallion, colt. Okay, if we talking about horse, mare, that is horse is if we are talking about male, and the female is mare. Okay, dog in this male and bitch is here female. And drake and duck, similarly drake and duck. So the odd one is stallion, colt. Stallion, colt is the odd pair. Stallion is adult male horse and colt is young male horse. Okay, colt is young male horse, while if we talking about horse, mare, male and female adult horse, and if we talking about dog, bitch, that is male and female adult dog, and drake and duck is male and female duck. So the odd one is stallion and colt. Yes, very good, Niharika. So question number 188. Ravi and Ram are friends. What is the part of speech of and? हमें बताना. Like we have to know what is the part of speech of and is here. That is noun, preposition, conjunction, pronoun. And question number 188. Ravi and Ram are friends. So in this sentence, you have to find which is the part of speech is and. (188) option number C, yes. Found my profession, option number C is correct, yes. Conjunction. Conjunction and is conjunction here. If we talking about noun is the name of a person or a place. Okay, so pronoun that is used in place of noun said to be pronoun in conjunction. That is and or are the two words that we use in conjunction that join the sentences or words or the name of a person. Okay, so conjunction here Ram and Ravi and Ram, and here is conjunction. Conjunction. Okay, so in this sentence and is a conjunction. Conjunction is a word used to join, connect words or phrases or clause. So here and is conjunction. Ram and Ravi is connected by and with the conjunction. Question number 189. Identify the adjective. So the blue sky looks beautiful. So what is adjective in this? So in this sentence, what is adjective? The blue sky looks beautiful. The blue sky looks beautiful. Gaurav, blue, yes. Option number B is correct. Here blue is adjective. So option number B is correct for 128, 189. So adjective is a word that describes a noun, okay, which that describes a noun. Like what type of sky is here? Blue colors, blue color. So blue is adjective here. So blue color looks beautiful. Blue describes the noun sky by telling its color. So the here the is article, blue is adjective, sky is noun, and looks is linking the verbs, and beautiful is predicate adjective. Okay. Now move to the question, that is 190. Choose the pronoun. We are going to school. So we have to find here what is pronoun. We are going to school. So pronoun is the term we use in place of noun that's said to be pronoun. So in this question, what is pronoun? Are we going school? Are we going school? Which one is pronoun in this sentence? Yes, Sanika, very good. We is the pronoun. Gaurav, as I told that pronoun, the word we used in place of noun, said to be pronoun. If I say here someone name, that is like Aditi are going to school, so Aditi is a noun, but we use here we. Okay, we is a pronoun. So we are going to school, so we is pronoun here. Yes, we. Riya, Sanika, Niharika. So the correct option is we. Okay, Gaurav? Okay, now move to the next question, that is 191. Fill the correct conjunction in the following sentence. So we have to fill the correct conjunction. Okay. That chocolate cake contains dash eggs dash nuts. So what is the answer? Either nor, neither nor, both or, not only or. What is the correct conjunction used in this sentence? Which conjunction is used in this sentence, like either or, neither nor, both or, and not only or? 191 B, that is neither nor. Yes, we always use neither nor, and with either we use or. Either or, neither nor, both. As you see many sentences, when we use both, we said A and B, both A and B. So with both we use and. Okay, so option number B is correct. Option number B is correct. That chocolate cake contains neither eggs nor nuts. Neither eggs nor nuts. Okay. Yes, option number B is correct. Sanika, pharma profession. Yes. Now move to the next question. Choose the proper noun present in the sentence from the given position. So we have to choose the proper noun that is present in the given sentence. The sentence is Sita was a very intelligent girl. So we have to find the proper noun here. Sita was a very intelligent girl. So we have to find the noun here. Sita, yes Niharika, Sita is a noun here. So the correct answer is noun. That is option number A, that is Sita. Yes, A. Gaurav, Sanika. So the proper noun is a sentence. In the sentence is Sita. Sita is proper noun and girl is common. If common noun is when we talking about anyone like girl, boy. Boy is also a common noun. But when we talking about a particular person, that it is proper noun. Okay. So Sita is the proper noun in the given sentence. Okay. Now question number 193. Choose the correct pronoun to complete the sentence. This is the book dash I told you about. So this is the book. So the correct answer is no, Niharika. Whom is not a correct answer. Like whom is also used like a but it also used in a object form. Whom we used in a object form. So the correct answer is which? This is the book which I told you about. So which is relative pronoun used for things or object, and here who is used for people? Yes, which, Niharika? Yes. And like whose shows the possession or ownership. So the option number C is correct for question number 193. Now question number 194. Choose the correct option that detective was a very experienced man. So dash detective was a very experienced man. So in this sentence we can say that they are talking about a particular person. Okay, that's why they said detective was a very experienced man. Okay, so they are here in this sentence they are talking about a particular person. Okay, when we talking about a particular thing. Okay, when we talking about a particular object, in that condition we use the. So here the is the correct option. The detective was very experienced man. Okay, so the answer is the 194C. Yes, option number C is correct. Farmer profession, Niharika. Yes, the. And A and N we used before the vowels. Okay. Now move to the next question, that is question number 196. So the question number 196, before the new year we usually have dash wonderful party at dash school. So the answer is the dash comma no article and no article. So as you see, we have to write an we have to put an article here before wonderful, and wonderful is not start with a vowel. Okay, it start with a consonant. So we can say that before the new year we usually have a wonderful party at dash school. 196, option number C. Yes, option number C is correct. And no article is used before the school. Okay, so the answer is before the new year we usually have a wonderful party at school, because no article is used before the school. Yes, option number C is correct for 196. Now move to the next question, that is 197. In question given below, out of 4 alternatives, choose the one which can suited for the given word sentence. Okay, so tending to move away from the center or axis. Okay, when the object tends to move away from the center. Okay, so what we called centrifugal, centripetal, axiomatic, every. Yes. No, centripetal force is different than centrifugal force. Centrifugal force is that force moving towards the center. So option number B is Incorrect. Option number C is correct. Option number A is correct. Centrifugal force. Centrifugal force tends to move away from the center, okay, while centripetal force towards the center. Okay, if we are talking about the force, centrifugal means, if this is the center, centrifugal means towards, that is away from the center. Centrifugal, that is away from the center, while we are talking about centripetal, centripetal is towards the center. Okay, so in this question, tending to move away, so away from which? Away from the center or axis, that's said to be centrifugal force. So option number A is correct. Understood, Gaurav and Niharika? Centripetal is for towards the center, but here we are not talking about towards the center, we are talking about move away from the center. Yes, option B is correct, Gaurav. Manisha, option B, option A is correct. Yes. Gaurav, option A is correct, not B. Now here's the explanation. Centrifugal means moving towards from the center, while we are talking about centripetal, moving towards center. And when we're talking about axiomatic, self-evident is said to be axiomatic, and every note straight wrong. Okay. Now move to the next question, that is 188. Arrange the given words as in a dictionary and tick the one that comes first. So which, according to the dictionary, which word comes last? It means fourth position. Okay, if according to the dictionary, that comes fourth. Like all are started from F, that F, 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 F. Then A, A, A. So the last option number C is correct, that is finger. Yes, Niharika, very good. Option C is correct, finger. Manisha, pharma profession. Yes. Option number C is correct for question number 198. Now question number 199. To talk one's head off means. To talk one's head off means. To talk one's head off. To talk excessively. Yes, very good. To talk excessively is the correct answer. Good afternoon, Harendra. To talk excessively. So option number D is correct for question number 199. Here's the explanation. To talk one's head off means to talk excessively or continuously for a long, very long time. Okay. To talk loudly means to speak in a loud or high pitch or a high voice. Okay, and to talk in a whisper, like to speak very softly or quietly. Okay. So to talk excessively is the correct answer. To talk to. Okay. Yesterday I saw this owl outside the window. So yesterday I saw this owl outside the window. So what is the answer for this question? Which article is be used in this sentence? Option B, yes. Manisha. Pharma profession, yes. An owl. Option number B, because owl start with vowels. Okay. A, E, I, O. When we use we talk about vowels A, E, I, O, U. Before all these 5 words, all these vowels, we use N, and we talk about consonant, then we use A. Okay? Yes, and owl, Harendra. Now, thank you very much for this class. Okay, so I hope you enjoy the complete marathon. Okay, so very all the best for your exam. Tomorrow we will meet again. Okay, so make more practice, more and more practice. Definitely you will crack your exam. Okay, so we will meet tomorrow. Thank you everyone. Okay, thank you everyone. Okay, we will meet tomorrow.